Please come to order. Our recess is over. We're ready to start again, and we're going to start with Ms. Jeanette Cudmore, our Chief Financial Officer, for our public hearing on a supplemental appropriation ordinance.
Thank you.
You got it, Jim.
Thank you, Commissioner President Guy. We were here on February 8th, and we requested the public hearing. We advertised on February 11th and 18th, and now today is the day of the public hearing. Section 27.9 of the Code of St. Mary's County, Maryland authorizes and empowers the Commissioners of St. Mary's County, upon the recommendation of the CFO, to make additional supplementary or emergency appropriations from contingent funds, provided that the CFO shall first certify in writing that such funds are available for such appropriation. The funding will be grant funding, being allocated from the state and/or federal sources. In accordance with the Resolution 2016-06, the public hearing is held open for 7 days for written comment prior to and being placed on the Commissioner's agenda. The FY22 budget included $1.5 million in an appropriation reserve to provide budget authority for additional grants or other revenue that may come forward during the fiscal year. We have exhausted this reserve. There were 3 large awards, additional revenues that came in: $398,000 for the CSM Wellness Center, $625,000 for the Aging and Community Services CDBG Block Grant, Round 2, and most recently, $200,000 came forward for the Charlotte Hall Veterans Home Ambulance. In preparation for the upcoming grant awards in FY22, a supplemental appropriation totaling $4 million is needed to have sufficient budget authority to move forward with the anticipated grants should they come before June 30, 2022. $2 million for the ERAP letter of interest. That was on your agenda, the application on October 19, 2021. $2 million for additional grant awards revenue through June 30, 2022. There was a broadband grant that was submitted also, I think, October, November, and that may also come, and that was about $2 million, may also come by June 30. The timing at this time, we don't know, but we need to be prepared so that we can spend the funds. So this is the public hearing. We will come back on March, the public comment ends on March 8th, 2022, and then we will come back on March 15th for your decision.
Okay, very good. Got it? Okay. Okay, thank you very much, Ms. Cudmore. Next, David Weiskopf will now provide the format for the public hearing.
Thank you, Commissioner President. Here are the guidelines for the Commissioners of St. Mary's County public hearing for the Department of Finance's request for a supplemental appropriation ordinance. If you wish to address the Commissioners via teleconference, please call 301-475-4200, extension 1234, to provide your name and address for the record. You will then be given an opportunity to speak to the Commissioners through the phone conference. All speakers who wish to address the Commissioners in person are asked to fill in the sign-up sheet located in the lobby of the Chesapeake Building. All speakers will be allotted 3 minutes to address the Commissioners. At the end of the 3 minutes, our Communications Director, Elisa Casas, will let you know your time has expired. We ask that you respect the 3-minute time limit in order to give all those who wish to participate an opportunity to be heard. This public hearing is being televised live on St. Mary's County Government TV 95 and the county's YouTube channel. If you should miss any part of this hearing, it will re-air on Channel 95 this Friday, March 4th at 6 p.m. and will remain available for on-demand viewing on the St. Mary's County Government YouTube channel. Citizens were provided an opportunity to address the Commissioners via video submissions, but since we did not receive any submissions, we will now begin accepting comments for those who have signed up to speak in person. Sharon, do we have anyone signed up to speak? No, we do not. We will now begin accepting comments through our teleconferencing system. Ms. Casas.
Mr. Weiskopf, Commissioners, it doesn't appear that we have any calls. I'll check in with our call center.
Public hearing call center.
Hi, Julie. It's Elisa Casas. I'm calling to see if we have any calls on our teleconference center today for the Commissioners of St. Mary's County public hearing for the Department of Finance request.
We do not.
Thank you, Julie. Commissioners, Mr. Weiskopf, we have no callers this morning.
Thank you, Ms. Casas.
So,
please note that the public...
One quick thing. The
Yes,
only
sir.
thing I would ask is that for public hearings, we make sure we have the phone number for dial-in on the screen so people watching can see it and know where to dial
Certainly.
in, because it's kind of quick to catch it if they're just listening. But thank you.
Certainly. Thank you for that. Please note that the public comment period will remain open for 7 days until close of business on March 8th. Should the public wish to send an email to If you do, please send it to csmc@stmarysmd.com or U.S. Mail to P.O. Box 653, Leonardtown, Maryland, 20650. Commissioner President Guy, that concludes our public hearing.
Thank you, Mr. Wyckoff. At this time, further comments, please either call or send in the emails he addressed it. The public hearing is closed.
Thank you very much.
Okay, next on our agenda is the St. Mary's County Board of Health, presented by Dr. Brewster, our health officer.
I move to adjourn as the Commissioners of St. Mary's County and reconvene as the St. Mary's County Board of Health.
Second.
I have a first and second. All in favor? Aye. Any nays? Ayes have it. We now convene as the St. Mary's County Board of Health, and Dr. Brewster, you have it.
Morning.
Good morning.
Good morning, Commissioners.
Good morning.
It is March 2022, and this month marks 2 years since we first experienced our first COVID-19 cases here in St. Mary's County. So since that time, we've diagnosed over 23,000 local COVID infections, and we've seen over 200 of our residents pass related to COVID-19. I know all of our hearts really are there with the families who've lost loved ones. In these 2 years, though, we've also seen our community come together really in a very unique St. Mary's County kind of way. We've responded to the challenge of an unknown virus in a very strong partnership. There are many partners who've been part of this effort. There have been many community members who've also been part of this tremendous response and acting to protect themselves, their loved ones, and their community. And on behalf of our St. Mary's County Health Department team, I'd really just like to express our deepest gratitude for all of our partners and community members for their efforts and sacrifice over the past 2 years. As we continue to deal with the unknowns of this pandemic, but we start to shift our approach to recovery, the role of our partners and community members continues to be critical. So fortunately, today, I'm able to share some very encouraging news. I'll go through some data metrics first and then talk about some recent changes at the CDC. If you go to the next slide, please. Our local metrics show that we're recovering briskly from the recent Omicron surge. I expect cases to drop in the next couple weeks. If you go to the next slide, this is reflected across all age groups with the lowest rate of cases in that 60-plus age group. Next slide, please. This graph here is a good indicator of weekly new cases by vaccination status. We changed the language at the bottom a little bit just to be more clear. The primary series complete means someone has had at least 1 dose of Johnson & Johnson vaccine or at least 2 doses of the mRNA vaccine. Next slide.
Dr. Brewster, why did you add that this time? We haven't seen
We
it
just
before.
changed it because we're going to be adding another category soon to separate out people who've actually been boosted. So we've set it up so that they have primary series complete.
I don't understand why.
It's what we had before was fully vaccinated or not fully vaccinated.
Yeah.
So we've changed the language of using fully vaccinated to up-to-date language. And so here we're using primary series complete because we don't have the data yet to be able to distinguish
Does that mean
those.
completely vaccinated when you say primary series?
I'm sorry?
When you say primary series complete, that's fully vaccinated.
Fully vaccinated was old language, yes. But primary series complete means that they've had 2 doses of their mRNA vaccine. That's their primary series. But they might not have had their booster dose, even if they're recommended for it.
I just think it's odd that after this long, we're having new definitions put out.
It's It's another, we did change our language a couple months ago to say up to date as more and more people became eligible for booster doses. If you remember, we started making booster dose eligibility happen in the fall is when that started happening. So as more and more people become eligible for booster doses, it's important to distinguish between those who've done their original series but haven't done the booster dose versus people who've done their original series and have had their booster dose, which is what we call up to date.
Okay.
Go to the next slide. As we've seen for most of the pandemic, the higher rates of infection are associated with those who have not completed their primary series of vaccine. This includes individuals who haven't yet gotten any doses of vaccine. And the next slide, about 64% of our population has now completed their primary series, and about half of them have also obtained that additional dose would be considered up to date in their vaccination. So Commissioner Morgan, back to your question, that's partly why we changed the language, again, so we can show the rates and the distinctions between people who've completed their original series and then people who've done that, plus also have gotten a booster dose.
Okay, can you explain on this chart? We've had this big push now, CDC, et cetera, to get all these younger kids vaccinated. And I mean, that's been a big, read the newspaper, listen to the news, et cetera. Yet, it doesn't seem like they're listening very well.
So in our county, as you can see, if you look at the top chart in the corner there, that's their completed final vaccination. For the 5 to 11 age group, it's about 23%. And for that 12 to 17 age group, it's about 54% who've completed that original series. A lot of them may not be eligible yet for a booster dose, and that's why the booster dose percentages in the bottom chart there are so much lower in those age groups. But we have made progress. I mean, if you think about it from a few months ago, one, we didn't have 5 to 11-year-olds eligible until just a few months ago. And then the 12 to 17-year-olds, that percentage has increased significantly over the past handful of months as well.
Do you see more of that age group trying to get shots, or is it stagnant?
So we're not seeing as many people coming in for their original primary series now. Most of the people coming in are getting their booster doses. We are seeing some increase in that 5, and on all age groups, but especially in that 5 to 18 or 5 to 17 age group. And that's just with time, as parents become comfortable with that decision, or as they make that decision, they move forward with getting vaccine. So yes, we are seeing some people get vaccinated in that age group. It's not a lot of people every day, or type of thing. I mean, it's a slow pace.
Do you think people are just getting tired?
That may be it. There's a lot of reasons. I mean, there are individuals who haven't chosen to get their kids vaccinated as of yet. And they may be waiting for more information. They may be waiting to see how things roll out. They may be wanting to see how the COVID pandemic rolls out, what kind of situation is going on with the pandemic before they make that decision. Go to the next slide, please. You look at this chart, this breaks it down a little bit more by age group, by decade of age. And the lighter column are individuals who've gotten the additional dose, compared to the darker column are individuals who've completed their primary dose series. The next slide are COVID-related fatalities. And as I mentioned, we've had over 200, it's actually 205 as of yesterday, St. Mary's County residents who've had a COVID-related fatality.
So if I look at this, under 50 have less than 10 deaths, is that correct?
Yes, if you look at that, less than 50, it's about 11, I think is the number.
And those are St. Mary's County residents?
Those are all St. Mary's County residents,
but the
correct.
predominant number of deaths seems to be occurring
In the 60 plus.
older, elderly people.
Absolutely, yeah. And
who
that's
were
been,
following the instructions of getting their shots and still succumbed, it seems.
not necessarily, and I'll go through, actually, the next chart goes through COVID deaths by vaccination status. The majority of COVID deaths have been occurring in individuals who have not been vaccinated or have not completed their vaccine series. If you go to the next slide, please. But you're correct, most of the fatalities have been happening in that 60-plus age group. That's been something we've talked about since the beginning of the pandemic as well. But it is mostly happening in those that are not vaccinated.
You're looking at the chart, it looks like there's only about, what, 21 or 22 that are less than 60 that died?
If
Do you
look
have
at
a-
the
do you have a
prior
number?
slide- The prior
I'm just
slide.
looking at the chart, it looks like it's only about,
Yeah, there's
21,
about 20 or
22.
so individuals who
so
are
all of them
less-
between 60 and 90 or older are the ones that have really passed away on this.
Yeah, that's correct.
Interesting.
Those are St. Mary's County residents. If you go, and so the majority of, we definitely saw a significant impact from Omicron on deaths in January, the last column. We'll be updating the column soon for the month of February, once we get our records from February finalized. Next chart, please. All right, so thank you. This past Friday, the CDC transitioned from relying upon a standard that they had developed in the fall of 2020, before vaccines rolled out, to a new standard. The new standard is in the current pandemic times, post-Omicron, may better predict higher death rates and load on a community's healthcare system. So when the original community transmission standard was developed, the goal was to limit community transmission in order to prevent strain on the healthcare system and severe illness, including that which leads to fatalities. At that time, we didn't have widespread vaccine or protection from natural immunity as well, and we also didn't have multiple treatments. So the rates of new infection and positivity were actually pretty well associated with or relevant to the strain on local healthcare systems and fatalities. So since then, and more specifically since Omicron, we've had a different situation. Vaccines are widely available to everyone age 5 and older, and even the most recently eligible age group of 5 to 11 have now had at least a few months to get vaccine on board. We also, during Omicron especially, developed some level of natural immunity or more natural immunity from all the infections over the past few months. COVID vaccines, in particular, the mRNA vaccines, have been very effective at preventing severe COVID-19 illness and death, as they were intended to do. Their ability to prevent any infection, including mild infection, has varied based on the dominant COVID strain. For example, they really didn't do so great at preventing infection during Omicron. And we saw that including in the 5 to 11 age group as well. But they've consistently done well at preventing severe infection and death in the larger population levels. We know that the protective effect, though, doesn't seem to last forever. During Omicron, we learned that the protective effect of the vaccine for the variant relied upon people getting boosted or staying up to date, that new language that I mentioned before, given the many months that had passed since they had their original COVID vaccine series, or their primary series. But the vaccines still remain the best tool we have in preventing severe COVID infection and load on our healthcare system. So while community transmission, that old standard, still helps individuals assess their personal risk of getting any infection, so that includes mild or even asymptomatic infection, the community level, the new standard, helps whole communities assess their risk of strain on their healthcare system, as well as future fatalities related to COVID, because typically fatalities lag a few weeks behind the load on our healthcare system and the numbers of cases. So local communities really should then take these national standards and consider them within the context of their local resources and local additional data that may be available to them. And that includes wastewater surveillance data and emergency department utilization data. Again, those data are not available to all communities across the country, which is why one of the primary reasons they were not considered when the CDC was looking at what kind of national standards to develop. They needed to include metrics that were available all over the country.
Dr. Brewster.
Yes, sir.
I just saw this morning when I got a copy when I came in. And what's been my concern is, I use the term moving the goalpost.
Okay.
Now, this high-risk red, we've been under that for a long time.
Yeah, since the fall of 2020,
And when I saw
or that assessment
300,
standards.
400 cases, I was thinking, man, that red makes sense. But we're down now to 10% of that. And the other thing is...
A little over 100 cases a week.
Okay, well, I apologize, maybe I'm not, I thought I saw something like 43 or something, but enough. My point is this: what metric can we look to, can we grasp to, that's going to say, you're at a high transmission, you're now down to substantial or moderate? Because what confuses me is we see the CDC, states, New York, California, getting rid of the mask, the Board of Education for the state of Maryland removing the mask requirement. When are we going to get out of the red?
Yeah,
You're
well, and
always
that's actually what I'm talking about here, which is the community transmission, as you said, is an old standard. It's something we developed in the fall of 2020, and we've gone through different colors since that time, and more recently, especially during Delta and so since then, have been in that high transmission.
Again, my point is, are we in the green or are we in the red?
So we're, according to community transmission, or that old standard, we would be in the red. According to this new standard that I was just introducing, the community level, we would be in the green.
So from now on, we should see community level versus...
Right, and as I'll talk about in a moment, it's important for us, I think, as a community to look at community level, because this new standard is a better reflection of the strain on our healthcare system and the better way to predict the fatalities that we may have in our community in a few weeks. And so as a community, it's more important, I think, to look at the community level. It's still good to keep an eye on community transmission when people want to assess what their personal risk is of getting infected. Not necessarily severely infected, but just infected.
All right, well, I guess my thought process is this. For years and years and years, we've had flu and cold season, and it's been when it's cold. And then when it warms up, flu and cold season goes away. That's all gone now. It's about community transmission or, this high infection rate. It's just confusing.
This isn't specific for flu or cold. This is more specific for COVID. But I see your point that you're making is that, it's not just a season. We're not in a place where COVID is seasonal like flu or some cold viruses are.
Right.
So
glad
when
to
we
see
get
we're
to that point, it'd be great if we can even just walk away from these things. But we're not at that point yet. But good point.
The interesting thing, it sounds like, with this community level metric is that it's going to be different for every community in how it's measured based on that community's resources and ability. So we have the wastewater metric that we can use, whereas other communities might not. Am I understanding that right?
No, actually, and so let me clarify. The
Okay.
community level is dependent upon the 3 indicators that I've listed here.
Okay.
Right? The 7-day new case rate, the 7-day new COVID hospitalization rate, and the 7-day average percent of inpatient beds occupied by
Okay,
COVID
I see.
patients. Those metrics and data tend to be available from all communities across the country. That's why they rose to the top as to why the CDC would use them to develop this new standard. What the CDC and what public health is recommending is that because this national standard is there, that's a great initial thing for a community, a local community to look at. But the local community should then consider what other things that they have that are relevant to their local situation, their local context. And that's when locally, as a health department, we'll also look at other data that we may have available to us
Okay.
that maybe other communities in the country do not. And we'll also look at things like what kind of resources we have in our community, healthcare access here in St. Mary's, availability of testing, all those types of things, before we come out locally and making recommendations to our residents. Is that better, clear?
It is, yes, thank you.
Well, what would have been easier on this chart, at least to this simple mind here, is that you have something at each one of these blocks saying, all right, low transmission rate, if it's 5% of 100, that's low transmission. Well, the next one may be 7%, next one 10%, next one 20%. We have a high transmission rate. There's just nothing here to regulate
Yeah,
how
there's-
much of a percentage of those that are testing positive what is, that would be a transmission to me.
Sure, and I can share that with you. There's actually 3 metrics, so and not just one metric. So the 3 metrics that I've listed here under community level all get considered when determining which, color box you end up
Because we
in.
have a high transmission, but yet your charts that you showed, the first 4, whatever, we've got a low number. But yet this high transmission
So
has
the
not
high
changed.
transmission, again, the community transmission is a standard that was developed in the fall of 2020, right? I'm putting it up here to illustrate how we've changed from focusing just on community transmission.
We've stayed high transmission all along now.
The level, right.
It hasn't moved.
Yeah, no matter what.
Hasn't
we're
moved. No matter
always
what
high.
happens, it can be up to hundreds and down to 10.
Not necessarily. There have been times where we've been in the moderate or substantial in
hadn't
terms
changed.
of community
I don't know if I've ever seen
transmission metrics.
I don't remember I've ever seen.
Pre-Delta.
But it seems like the
Maybe we
big
need to get rid of that
takeaway
chart. That chart
is-
looks bad to me. I mean, we're looking
The
at the community
takeaway
level
is
low.
the community level is low, and that's a good thing.
Yes.
We should be celebrating that.
Yes.
Correct.
This is good.
And I'm suggesting that as a community, we should be focusing more on this community level standard
I
that the
agree.
CDC has put out.
I agree.
Because it's a better reflection of load on our healthcare system and the fatalities we might see a few weeks that lag behind cases.
Yeah.
Right? So I think as a baseline, it's a good place to start, community level. If you go to the next slide, though, when residents are making their individual decisions about protective actions, they may also want to consider some of these other factors, which I'll go into in a moment. So ultimately, what does this all mean for individuals in terms of individual risk and protective actions like masking? Because post-Omicron, we have a much different picture of the pandemic than we had even just a few months ago. I think it's important, again, for people to pay attention to this new standard, the community level standard, which would be low now for St. Mary's County, when they're making decisions for their families, their workplaces, and their communities. And when making these decisions, though, they may also want to consider what I've listed here under additional considerations. And that's where that community transmission standard comes in, right? Because again, that's more an indication of just the spread of infection, not necessarily the potential for severe infection impacting community healthcare systems. And again, local context is really important. That's why our St. Mary's County Health Department makes our recommendations for local protective actions based on this new national community level, but also as we understand that local context, those local data pieces and an understanding of local resources. So overall, at this time of low community level, St. Mary's County Health Department is recommending that masking be a personal or workplace decision based on a personal risk assessment or an impact on workplace assessment if an employer is making that decision. So workplaces may have their own policies because they best understand their workforce needs and the impact of even one person in their workforce getting sick and being out of commission for a while. So we provide our recommendation with a few caveats. Because, again, we're paying close attention to some of these additional considerations that impact our local situation. So, as I mentioned, the local data shows our county to still be in that old standard of high community transmission, which means the personal risk is higher of getting even mildly infected and maybe passing the infection on to others even before people have symptoms. And so that's why partly why I, as a healthcare provider and a parent, I choose to wear my mask today indoors. I personally would like to see our new case rates decline a bit more before I take my mask off in indoor public spaces. And I'm hopeful I'll be ready to do that in another week or two, based on the trends that we're seeing
That's why
now.
we're maintaining 6 feet from you.
I think all the time,
Or
isn't it?
better.
Other considerations people may want to consider when making their personal or workplace decision is their personal home life or their work settings, their immunity, either from vaccine or infection, and the emergence of other variants. And I'll talk about all of that in a moment. So our health department recommends that when people and workplaces make their decisions, they consider also the availability of treatments, locally, and the ongoing concern of long COVID, which I've talked about in prior Board of Health meetings. So since January, actually since December, but mostly since January, we've had new FDA-authorized treatments for COVID, including oral options or medications that people take by mouth. And those options are new, and they're great that they're now available, and we did not have those options just a handful of months ago. But they are still pretty limited in their access, right? I mean, there's still pretty limited access to these treatments, especially those oral ones. I think this access will continue to improve, though, as manufacturers get a chance to produce more and as the demand for those medications lessens as we come out of the surge. So again, over time, that situation related to oral treatments and readily accessible oral treatments like antiviral medications should improve and help us transition from this pandemic.
I'm going to go back. I'm getting confused.
Okay, happy to clarify.
We keep staying in the high transmission. We have the red lights, danger, et cetera. What is that relative to?
If you scooch back, sorry, to that original slide with the 2. Okay, so this was an old standard from fall of 2020.
Yeah.
That is based on the 2 metrics that I've said here, the 7-day new case rate and the % positivity. Those parameters, again, were developed at a time when we didn't have widely available vaccine, which promoted protection from severe illness, and we didn't have all these treatments that we now have. And so the reason for that standard was more to protect our healthcare system and to prevent severe illness leading to fatality. After Omicron, or as we're coming out of Omicron, situations have evolved quite a bit in the past several months. We have many more new treatments available, although there's still limited access. We have a lot more people who are vaccinated, including those 5 to 11-year-olds, and we have natural immunity that's built up from all the people that got infected during the past handful of months. So that changes the picture. So that means that just looking at your new case rates doesn't necessarily tell you what the strain on your healthcare system is going to be or how many deaths you're going to have in a few weeks, right? What's more reliable as an indicator of strain on a community and their healthcare resources is this new community level. And so that's what we're transitioning to. We're stepping away from community transmission, that old metric, and we're starting to focus more on community level, which is where we would be low.
Can your next meeting eliminate the community transmission chart?
Sure. I'm showing this because this happened Friday afternoon, and I'm trying to show how we're transitioning.
It's confusing to me.
But if it's confusing, I apologize.
It almost seems like we're not you, but the CDC, I mean, the CDC says drop, the schools are saying drop, everyone's getting tired, blah, blah, blah. So we're going to create now a new modicum, a new way to grade the system. So community transmission, we've been high and in the red, and everybody's listening, and
Yeah.
we've heard it for 2 years. But okay, now people are, as I used to work for, people are tired of listening to community transmission. They're tired of hearing red. So now we're going to help on the new denominator.
And now, woo, all of a sudden we're green.
Now everything's out the window
Yeah.
again. Now we're going to face those community level.
And to be honest, I had the same concerns when I heard about this developing at the CDC, and I was concerned that are we departing from science and we're focusing on fatigue, right? We need to stay true to the science throughout all of this. But as I've learned more, and I've been part of presentations that the CDC has given to public health professionals and healthcare providers, and I've read about their scientific strategy that they use to come to this community level, I've definitely, my appreciation for this has changed, and I really think that this community level standard is a better way to reflect what we're concerned about at the community level, which is what we've been talking about this whole
And we
time.
agree.
Overwhelming our healthcare system, the fatalities and the people getting severely ill. That is what we are most concerned about, and we have been concerned about since the beginning of the pandemic. But in the beginning of the pandemic, we didn't have all the tools that we have now to help protect individual people. And so again, I think this transition from community transmission to community level is better for whole communities as we look at making recommendations to our population. people may still want to know how many new cases are happening every day, which speaks more to community transmission, because they're trying to assess their individual personal risk of getting infected. Not necessarily severe infection, especially if they're up to date on their vaccine, but their risk of getting infected. If somebody's immune compromised and isn't responding well to vaccine, or they are not getting vaccinated, they still may want to know what their risk is for getting infection, because that, for them, that's an indicator of their risk for severe illness, right? So I think it's still important for people to have that data, but as a whole community, I think it's important for us to focus in on that community level based on what I just
see
talked
that.
about.
It just, as I said, when you see a chart like that,
Yeah.
it develops a whole level of skepticism as to dire
Motivations.
consequences. It's getting a little bit better, and
Yeah.
then, depending upon how the politics of the game works and the science flows and weather changes, et cetera, we'll have a new something in 3 months again.
Yeah,
possibly.
yeah, and honestly, this is a pandemic. Things are constantly changing, and we've seen that for 2 years. How we have had to adapt, we've had to deal with new situations, emerging treatments, emerging vaccine. Things have been constantly changing. This is a very dynamic virus, including with new strains all the time, and it has been an exceptionally dynamic pandemic. And as we're learning and going through this, and as new things become available to us, new tools become available to us, and the situation changes, we also need to respond by changing our, what we rely upon as a way to predict how severe the situation is, right? We need to be responsive to the times, and that's what this is. It's allowing us to be more responsive to the current times of the pandemic.
Good, good.
Okay, if we go to
I
the
think
next.
we need to use the community level from now on.
That is the case now. And again, things, I can't predict especially with this virus, I've kind of stepped back on my predictions just because things have been evolving and changing so much. And, this may continue to refine itself as we learn more and as treatments become available and as
Right.
less burden is there. There's a variety of things that can impact what comes to bear.
Right.
But I think this transition, at least from what I've been reading and participating in to learn about this transition that the CDC has put out, I feel like this was a solid move on their part, and they had pretty strong methodology at arriving at the specific indicators that they used to establish this new standard.
And we as a community need to do a solid move toward normalcy. We have to do that.
We have to get there,
It's much
absolutely.
of an impact 2 years now later, and we're still.
We have to get there, but we also need to protect our hospital system,
we
and
need
we
to-
don't want more residents to die from COVID.
Those who do not get vaccinated, they
Okay.
understand they got to wear a mask, they take a risk, and things like, I understand all that. We need to make sure, but it's been 2 years now.
So one question, Dr. Brewster, not about community transmission. Long COVID, I know some people who are extremely concerned about it, but I hear it spoken about less and less. I haven't seen any.
So I'm going to speak about it.
Okay, good.
If you are okay moving down to slide 12, thank you for that transition. That's very helpful. So what I want to talk here is about one of the additional considerations people may want to consider as they're making their personal decision about masking. As I gave an example of myself and why I'm wearing a mask today and why I might not be wearing a mask in front of you next time at the next Board of Health meeting, that would be great. But when making these personal decisions, we recommend individuals consider personal and work factors as well, including their own vaccination history or their own history of having recent infection. Being up to date with vaccine, again, that up to date language to really account for the changing time now in this pandemic, which includes boosters if they're eligible for boosters, makes it significantly less likely that someone, if they're infected, will be hospitalized or die related to COVID-19. So having had recent COVID infections, such as in the past couple months, might afford someone some period of natural immunity or protection, though, of course, as I've talked about before, this may vary person to person. So given the higher community transmission we have here in St. Mary's County, and also our wastewater surveillance findings, again, this is data that's available to us locally, and we publish this on our website, which the wastewater data shows declining levels, but they still show higher levels of viral load in our wastewater compared to many other communities who are also in the green like us across the country. In addition to these other factors that I've already discussed, the health department is recommending continued use of masking in healthcare facilities or during healthcare services. And when people are making their own personal decision about masking, we are recommending they consider masking in crowded indoor spaces, public spaces, for those who have limited vaccine or natural immunity, meaning they are not up to date with their vaccination or they haven't been recently infected, they may be the ones who we would recommend consider masking in crowded indoor public spaces, or if they have a higher risk of severe disease, such as if they have moderate or severe immunocompromise. So those are, I think it's, again, really important for people to consider. If you go to the, I think it was actually, if you bounce back to the prior slide, sorry, I got a little distracted from the first one, but let me just go back and address Commissioner Colvin's question about long COVID. I'll talk about the emerging variant situation in a moment. I mentioned treatments and how we're hoping that in the next several weeks we'll have a better and better availability of those oral antiviral medications. I do want to address, Commissioner Colvin, your question about long COVID. I think that's a really important piece. And that, I feel, is the larger question mark in all of this. And you're right, there hasn't been as much media discussion of long COVID. There's been a lot more development around findings about long COVID in the scientific literature, but that's probably more what public health professionals and healthcare providers will pay attention to than national media, for example. But what I do want to say is that another important burden of COVID infections is not just the severe illness that lands you in the hospital or leads to a fatality. It is this prospect of what we're describing as post-COVID conditions, or what we were previously talking about or calling long COVID, all right? So these post-COVID conditions, this includes complications people can have several weeks, maybe even starting several weeks after they've had a COVID infection, or continuing symptoms of their COVID infection that they may have persisting for months even. So we still don't know enough about the burden of these post-COVID conditions, but more and more we're learning that the number of people affected could be pretty significant. And a variety of studies that have come out more recently suggest that even upwards of 10% of people infected, even with mild infection, can experience these post-COVID conditions. Again, we're still learning quite a bit about this, and there's some work we'll be doing here locally on this topic as well that we'll announce in the upcoming week.
Is there any age breakdown with that? Are we seeing that in
Yes.
elderly or where?
So it does tend to be more in individuals who've had severe illness. So if they've been hospitalized, and we know that hospitalizations and severe illness tend to slant towards older populations, so that might be influencing that as well. They have looked at it and have found that the one that people are really concerned about in children, for example, MIS-C, for example, that multi-system inflammatory conditions in children, that seems to be occurring much less in vaccinated children. So those 12 to 17-year-olds is the population that was especially looked at, because there's been enough time, is that their occurrence of that post-COVID condition appears to be a lot less if they're vaccinated. So that is something that really has come out, is that the vaccine and being vaccinated and up to date on vaccine seems to have a lower likelihood likelihood of having these post-COVID conditions, and that even if people have a post-COVID condition, there's a couple studies that also suggest that getting vaccinated might help them accelerate in their recovery. So overall, again, we're recommending masking. If you go to the next slide again, we're recommending masking be a personal or workplace decision, but that when people are making these personal or workplace decisions, that they consider all these extra factors I've talked about that we have here locally. We're also recommending masking in healthcare facilities and during healthcare services, and masking in indoor crowded public spaces for those who don't have the strong immunity, maybe they are not up to date, or they haven't been recently infected, or if they have a higher risk of severe disease like immune compromise. All right, if you go to the next slide. I wanted to mention that we are monitoring this new BA.2 subvariant of the Omicron virus. It is in this kind of pinkish, light purple, lilac, whatever that is, color at the bottom of some of these latter columns here. You can start to see it growing at the bottom. This is the HHS Region 3, which is kind of like our mid-Atlantic region, really. We are starting to see Omicron show up in our region. It's still in the works, but it's important to monitor because we don't want it to take hold in our population as a new emerging strain, like it has in some other countries.
Doctor, what is, since this is a new one, so what is
yes.
BA.2?
So there's Omicron. So if you look at this table over here to the
I
side.
see that, but all of a sudden we've now
It's
developed.
a new variant of concern.
Coming out.
A new variant of concern. It is a subvariant of Omicron. So it's related to what we've been dealing with the past couple months. And we think that people who have been infected, for example, in the past couple months, may have some protection against BA.2 if it comes around. Right now, it's according to all the genomic surveillance that's going on, it's at a very, very low percent, about 4% in our region. But again, it's also early signs seem to indicate that it's even much more contagious than what we dealt with over the past couple of months, the strain we were dealing with the past couple of months. And so that is something we're monitoring to see, is this going to emerge as a new strain and potentially as a new risk of infection to individuals, and possibly even those who've been infected already.
Well, it seems like each new variant becomes more contagious and less deadly.
We don't have an answer to the question about the less deadly part. I think we saw with Omicron that it was less virulent or causing less severe disease, but because so many more people were getting infected, that's why we were seeing such a heavy impact on our healthcare resources, and why, especially in January, we saw so many fatalities related to the Omicron surge. So even if a variant is less severe, which we haven't shown yet with BA.2, but even if a variant is less severe, if it's so very contagious, and this one does seem to be more contagious than the Omicron one that we've been dealing with, then we expect that the numbers of people who are at risk for severe illness and potentially death will be higher. However, again, this is where it's so important for us to encourage individuals to get up to date on their vaccine, and then also to support the availability of treatments that may also help prevent hospitalizations and fatalities. And I don't know if this BA.2 will actually take hold, because we're still so recent to the past couple months and all that natural immunity that's built up, as well as everybody who's recently gotten booster doses. Go to the next slide, please. All right, so if a person does make the personal decision to mask, or if a workplace decides to request it for their employees or visitors, we do continue to recommend more effective, well-fitted masks, such as the KN95s and N95s. You do not need to be fit tested for an N95 to work well. Fit testing does improve how an N95 will work, but it's not mandatory for somebody to be fit tested in order to get that strong effect from an N95.
As a point of reference, I failed my fit test for my N95 because I have a beard.
Was it the beard? Yeah, yeah. However, the material of the N95 itself, right, the material and the other fit of the N95 itself is great filtration. It just may not be that, awesome filtration that you'd get if it was the right one fit tested for your face.
Right.
So KN95s are still readily available through multiple mechanisms in our community. And again, thank you to our St. Mary's County Libraries for partnering with our health department and making these masks available. They're still there. We have them at our testing sites as well. So please, if you need that supply or are interested in that, particularly if you're deciding to wear masks, please go ahead and get that. Also, again, we don't quite know what's in the future, so this might be a good time to go ahead and get some of that supply. So if you get to a point in the future where we are recommending masking more widespread, you have those masks, the better masks readily available to you. If you go to the next slide, please, just some updates, also just to wrap up, some updates on testing. Regular PCR testing typically has a 1 to 2 day turnaround for us. We shift, as we shift some of our focus to recovery, we will be having some changes in the sites and hours for testing in the weeks ahead that we'll announce and keep updated on our webpage and by calling our COVID call center. But individuals can still use these sites, and appointments are recommended. It definitely makes it faster, but not required for the Hollywood Lexington Park. We'll register people on site as well if necessary. If you go to the next slide, please. I'd encourage our residents to keep some take-home tests available to themselves in their homes in preparation for when they need it, but then also in preparation for future surges that we may have. They can set up and get an appointment for collecting these tests at our St. Mary's County Health Department sites. We're also starting to go door-to-door in higher risk zip codes, and residents can also request a federal supply of test kits through the link that we have posted on our local health department testing webpage. Go to the next slide, please. Another kind of hot off the presses type of update that the interval between the first and second dose of the mRNA for people who are getting their original primary series of vaccine, and if they fall in this kind of category here, they don't have immune compromise, and they're between the ages of 12 and 64, and we're especially interested in making this recommendation for males between the ages of 12 and 39. They may want to consider, and we would recommend they consider, extending that interval of time between their first and second dose to 8 weeks. So if you remember with Pfizer series, it's 3 weeks typically, and so we would extend that to 8 weeks. With Moderna, it's typically 4 weeks, and we would extend that to 8 weeks as well. And then this doesn't affect Johnson & Johnson recipients. All right, last slide. All right, thank you so much. And again, Commissioners, I appreciate all your questions and leadership, and certainly appreciate all the discussion that we've had today. I think it's very beneficial for everybody listening.
Got a question.
Yes, sir.
For those of us who got the Pfizer early, when do we have to start getting, do we have a yearly, is there a program for a yearly dose?
So that hasn't been
Nothing's been established yet
hasn't
on
been
that?
recommended just yet. At this point in time, the only recommendation would be, so you have their primary series, which
22, yeah,
for
Pfizer.
people who don't have immune compromise, that primary series is 2 doses.
Right.
For people who have, moderate or severe immune compromise, such as individuals who are on certain medications that suppress their immune system, the recommendation is actually for 3 doses of that Pfizer or Moderna, right? So they would get the first 2, and then they get the third one about a month later.
That's a booster shot you're talking about?
Actually, that's considered part of their primary series.
Oh, is that
because they
right?
have immune compromise, they need an extra dose to kind of get to the same level that everybody who doesn't have immune compromise might be at with 2 doses.
So for those
The
of us who
booster
had first and
dose-
second and booster, we need to wait to see what y'all come up with.
So the booster dose recommendation is for 5 months or more after your final primary dose. So if somebody's doesn't have immune compromise and they've had 2 doses, bless you, of their original primary series, then 5 months later, at least, they could get their booster dose, right? If somebody is immune compromised and they had 3 doses, because of that immune compromise, they did 3 doses as part of their original primary series.
Right.
Then 5 months later, they can go get their 4th dose or booster dose, right? At that point, the 4th dose is considered the booster dose for them. That is as far as we have right now in terms of recommendations for boostering. It doesn't.
There's no
This doesn't
guideline.
mean that there's going to be a booster dose every 5 months, right? The immune system doesn't work that way.
Yeah, right.
The immune system needs kind of that repeat trigger sometimes to build immunity, but sometimes you don't need more than that. I mean, if you think of childhood vaccines, right? You go back for multiple doses, you might get a booster 5 years, you might get a booster 10 years, or you might stop getting boosters. I mean, some of that has to do with your exposure to the illness of concern, but some of that just has to do with how your immune system, functions.
So right now, there's no science, like we get flu shot yearly. So there's no
Right, right
science
now-
yet that's proven, since I got both Pfizer 1 and 2 and booster,
Right.
the science past that hasn't come out.
Correct.
What I should take next.
Correct. And part of it is
oral
we're
medications
still in
or-
a pandemic. This isn't, I mean, Commissioner Hewitt brought up a great point earlier about cold flu season. We're not at a point where we're dealing with a seasonal virus like the flu, right?
Okay.
We're dealing with something where we're seeing surges at different times of the year, depending on new variants that keep coming out. And part of the reason why these new variants keep coming out is worldwide, we don't have high levels of immunity. We are starting to get to higher levels of immunity here in this country, especially after Omicron, when you throw in some of that natural immunity.
Sure.
But worldwide, we don't have that. And so that's why we see all these new variants emerging, and we're still dealing with that, and we're still dealing with surges. But over time, hopefully that situation should improve. And while we may have new variants come out, we'll be better equipped, including from a treatment perspective, to handle some of that.
Okay, good, good.
Thank you.
Any other questions, Commissioners? No. Thank you very much for your time, Dr.
Thank you.
Booth.
Thank you all.
Appreciate it. Thank you.
I move to adjourn as the St. Mary's County Board of Health and reconvene as the Commissioners of St. Mary's County.
Second.
Have a first and second, all in favor? Aye. Any opposed? Ayes have it. Back to Commissioners. Okay.
Mr. President, one request on the Board of Health meetings. I do believe at this point that we should consider spacing the meetings out a little bit further unless there's some sort of emergent cause that is going to require action on
Right
behalf
now,
of the Board of Health.
we're at 2 weeks, we can go to monthly.
Yeah, I mean, I'm not opposed to monthly. I think we could probably go further than that and refer people to the health department for any other information unless there's going to be action that's needed by the Board of Health or there's some emergent portion. I think
Any more suggestions on that? Monthly or less, bi-monthly?
4 to 6 weeks.
yeah, yeah, you want to do
Well,
it
let's go every other month?
every other month?
Yeah.
Okay.
Yeah, we used to be bi-yearly, so bi-monthly, I think is fine.
I think a bi-monthly right now, and then
Okay.
we'll just make another decision about 4 or 5 months, if
Yeah.
reduce it more if we need
Yeah.
to.
Yeah.
Okay.
Okay.
That's how we're going.
Thank you,
Good.
Mr. President.
Sounds good. We'll have our county administrator pass that on to the doctor.
Certainly.
Good enough. Thank you. Okay, next we go right into, on our main agenda here now is Department of Land Use and Growth Management. Decision amend the comprehensive zoning ordinance for new use solar major and solar minor. Mr. Bill Hunt, the Director of Land Use Growth Management, will give a presentation.
Thank you, Mr. President. Good morning, Commissioners.
Morning.
Morning.
Next slide. A little bit of review, and then I'll get into some new stuff. The CSMC formed the Solar Task Force.
I'm sorry, Mr. Hunt, just a moment, please. Thank you, my apologies. You're good, just tell me when it's time to advance. I apologize, we're having some technical issues, but it is on.
Okay.
Okay.
Amy, I apologize. Can you see this view in the production studio? There we go. Thank you.
Okay. I don't have it in front of me, so I'll be looking down more than usual.
Okay.
But I'm not too good at the teleprompter anyway, so. CSMC formed the Solar Task Force in January 2020 The Solar Task Force made its report to the commissioners in August 2021. As part of the work of the Solar Task Force, the Chesapeake Conservancy provided an analysis of optimal solar sites in St. Mary's County. Next. As you've already heard, the proposed ordinance adds 2 new uses to the comprehensive zoning ordinance, solar major and solar minor. Next. For solar major, the sites to avoid that were identified are ecologically sensitive areas such as wetlands, prime agricultural lands and forests, and properties not compatible with the Navy mission. Next. The preferred locations, on the other hand, are degraded and contaminated sites, landfills, county-owned properties, parking lots, rooftops. At the public hearing, there were comments orally and also letters were received from agricultural interest groups. The Solar Task Force and these agricultural interest groups both support solar energy within St. Mary's County. By the agricultural interest groups that came forward at that time, they are the Agricultural, Seafood, and Forestry Board, the Department of Economic Development, the Farm Bureau, Patuxent Tidewater Land Trust, and Resource Conservation and Development. As I said, they all support solar within the county. Where they differ is that the Solar Task Force recognizes optimal, preferred, and then other sites, and does not want to exclude any properties from consideration. The agricultural interest groups would like major solar to not be allowed in prime agricultural soils. The groups that make that recommendation are the Farm Bureau, Economic Development, Patuxent Tidewater Land Trust, and Resource Conservation and Development. They also recommend
But would
not,
you repeat that what you just said, please?
starting
Groups
with
that do not want
major,
solar in ag areas include?
the groups are the types of areas.
The groups that are opposed to having solar in the ag section.
The ones that do not want major solar on prime agricultural soils are the Farm Bureau, Economic Development, Patuxent Tidewater Land Trust, and Resource Conservation and Development. Another recommendation is to not have major solar on farmland of statewide importance. That comes from Economic Development. And then also, they would not like them in rural legacy areas. That recommendation comes from Economic Development, Patuxent Tidewater Land Trust, and Resource Conservation and Development. At the end of my brief presentation today, Ms. Casas will show where the prime farmland and the farmland of statewide importance have been mapped, just to give you an overview of what that looks like on the county's GIS system.
Is that a actual designation, farmland of statewide importance?
Yes, sir, it is.
Interesting.
So at the public hearing, as I just said, the recommendations were do not allow solar major on those soils that I mentioned. So I won't need to repeat that. Now, the Farm Bureau recommended allowing solar major in rural legacy areas with the conditional use from the Board of Appeals. And I just want to mention now in general, because there were some other comments about conditional use. My feeling is that one public hearing for major solar uses with the Planning Commission is sufficient, that the ordinance will have protections for buffering, for instance, provisions. It gives the neighbors a chance to come out and discuss things at the public hearing. The way St. Mary's County works its conditional use process, if you have to have a conditional use, it goes to the Board of Appeals for a public hearing, and then the same information goes to the Planning Commission for a second public hearing.
So your recommendation is to make it a permitted use?
Yes, sir.
Thank you.
I would not have a conditional use in there. I don't see the need for it. Next slide. Let me see where we are.
What number are you on, sir?
I'm on 8.
All right, thank you, sir.
Correct. Okay. I wanted to point out that there are no uses in the zoning ordinance that are prohibited on prime agricultural soils, and that farmland of statewide importance is not a term in the zoning ordinance. Next. Rural legacy area is mentioned in the zoning ordinance, but there are no regulations. The Rural Legacy Area program is run through the Department of Economic Development primarily, and not through Land Use and Growth Management. Solar major facilities are prohibited by rural legacy easements, but neighboring RLA properties not under easement could have a solar major development, which is why Patuxent, Tidewater, and RS&D were against it, along with DED. The solar site, next slide, sorry. The solar siting report analysis finds that St. Mary's County can meet its state-required goal for solar energy generation without including the prime agricultural soils, productive farmland, and rural legacy lands. The county will meet its goal using 8% of identified optimal and preferred sites. The draft ordinance that you have in front of you, I included the recommended prohibitions because at the decision time, it's easier to say you don't want them in than to have them added. So if it's clear enough for today, you could just omit those that you don't like if there are any. Otherwise, they're included in the draft ordinance.
So, Mr. Hunt, in that regard, the statement you just made is that we will be able to attain our goal based upon what we have today. And then Commissioner Guy and I arduously sit through MACO and the green initiatives. We know, or it feels as though this is the starting point. And the goal to get to, a carbon-free footprint using solar and wind are the only two alternatives that they've put out there for us now, or to buy renewable energy from out of state, which would be, because everyone's so happy with their SMECO bill right now, an added cost. So there's been no discussion towards using nuclear. There's been no discussion. The discussion to get rid of fossil fuel is evident. So my concern is that by pushing this forward as we sit here today and knowing the mood of Annapolis is to push harder and knowing that wind is not a viable option for St. Mary's County, would we have enough land to, say, hit a 50% goal instead? I think it's 7% now, 13% now. I mean, they quadrupled down this last time to 13 or 15%. I can see it going higher looking at those renewables. So I don't know if, and I understand the not wanting to use ag land, obviously because you have to eat. And if you don't have food, if you don't have food, the electricity's not going to do much good. So my concern becomes that in the future, would we have, and it's rhetorical, because I don't think there's an answer to this at this point in time, to get to where we got to get to. And how do we structure, knowing that we have to get, I would think that the board wants to get this ordinance put in place so that we can at least proceed with meeting the state goals somewhere along the way.
Yes, sir. Of course, everything that you said is exactly right. When the solar siting report was presented, the goal for the county, based on what the statewide goals were calculated for the county based on the size of the county relative to the state size, which was the most conservative way they felt of determining how large the county's input would be. And even when they did that, a very small percentage of the optimal and preferred sites that they found in the county would be needed to meet the county's goal. So based on that qualitative assessment, without getting into the quantitative actual calculations of how many acres are in prime agricultural and farmland estate interest, which if Ms. Costas could pull that one up, you can get a visual of it. Clearly, the largest areas in the county that would be impacted are the darker color here. This is just a random shot within the GIS layer, but the darker colors are the farmland of statewide importance, which are based on the soil types which were included in the ordinance. And then the lighter ones are the prime farmland, which we're more familiar with here because it's a discussion that comes up more regularly than this farmland of statewide importance.
Pardon me if I don't see the irony when you use the word conservative with anything that comes out of Annapolis.
I'm sorry, sir.
It's I just see the humor in it. But one of the other concerns I have with this ordinance is, of course, the law of unintended consequences. Right now, dealing with some farmers that are involved in agritourism, and arbitrarily they're being assessed as commercial by certain acreage, whether they're only using the property for 20 events or 5 events. Of course, bringing their assessments from 50,000 to 864,000 in some instances. Of course, that's based on our local office and the assessments that they do there and go to the state. With that being said, looking at this, I do believe we're going to have to look at the provisions of this to ensure that any agricultural property that may be used for solar to meet the state requirement is not going to be assessed at a commercial level, thereby, raising those assessments on whatever farmer may have that there. Yeah, I think that we need to focus on that now, because we're going to have to be doing some cleanup on the assessments that are already involved with the agritourism, where they're getting classified as commercial. So what I want to see happen is a farmer that doesn't qualify on any of this, wants to use 3 acres of non-viable land, whatever they're going to do. Now all of a sudden they're going to pay a commercial tax on that when it's a requirement by the state, and they're just trying to help facilitate that.
I think the state nullified that.
Well, I want to make sure that's, I want to make sure that they're not going to get looped into a commercial on agriculturally zoned land.
That's something I haven't considered also.
Right, and I just want to get ahead of it. I mean, obviously, who knows where this is going to go, but why address a problem later on when we can get ahead of it now? So, thank you.
So, Mr. Hunt, the task force was formed in January 2020. There was discussions well in advance of that. So this is a process that's been going on for much more than 2 years. Good work. It's had a lot of community involvement, a lot of diverse groups involved, and I like what you've come up with here. I like the ordinance. I'm good with it.
Thank you, sir.
Mr. Hunt, I feel the same way, but I will say this. What I do worry about is people who are left out. When we talk about this rural legacy thing, I've seen my share of it, and it seems like some areas are areas that we, whether it be Mattaponi or Huntersville, where we try to encourage legacy there, and those people get to take advantage of those, whether they're conservation easements or whatever kind of easements the state puts on those, and then there's other places that don't. So I like your statement about we can meet the goals of renewable energy without involving good agricultural land. That's a good point. I hope we do not exclude somebody who has found farming not to be something that they can support or support their families or have their children to support it or something like that, that they get left out and farming is no longer viable. But lastly, I like the idea that we're looking at areas that have had issues with their properties, whether it be the Thiokol property up here. I remember my days back on the Board of Appeals back in the early 2000s with the munitions plant, and then the Hollywood wood treatment plant, and these different pieces of land that are actually unusable and would be prime candidates for this. So I'm fine with this too, and we'll go from there.
I move to approve the ordinance amending the comprehensive zoning ordinance to add the new uses of solar major and solar minor to the new amended definitions and the parking standards and loading space changes for the 2 new uses, and authorize the commission president to sign any related documents.
Second.
We got a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you.
Okay, next we go right into County Administrator time. Mr. Weisskopf.
Thank you, Commissioner President Guy. First up is the draft agendas for March 8th and March 15th. On Tuesday, March 8th, we'll start at the regular time, and the invocation and pledge will be by Commissioner President Guy. And then the approval of the consent agenda, and then there'll be a proclamation for National Athletic Training Month, as well as Women's History Day. I think that's Women's History Month, isn't it? But anyway, at 9:15, we'll have a request for a public hearing to amend the comprehensive plan land use from rural preservation to rural commerce and zoning map, from rural preservation district to rural commercial on property located at 41170 Oakville Road, Mechanicsville. And then county administrator time, followed by Office of the County Attorney legislative updates, Commissioner time, memorial ceremony for Mr. Leroy Williams, closed session for personnel, adjourn, and then reconvene at 1:30 for budget work session, and then adjourn. Tuesday, March 15th, start at the regular time, and the invocation and pledge will be by Commissioner Colvin, approval of the consent agenda, and then a proclamation for Social Work Month and also Equal Pay Day. And then Department of Finance decision for the supplemental appropriation ordinance, followed by the Office of the County Attorney decision for the Police Accountability Board, and then County Administrator time, Office of the County Attorney legislative updates, Commissioner time, adjourn, and then a 1:30 budget work session. Next is from the Office of the County Administrator, the YMCA brief, and I note that we have Mr. Robbie Gill and Bill Rigby. Brian, I'm sorry, close. Brian Rigby here, if they both want to come up and discuss what we've done. If I could give you a little bit of the history, please come up. As you know, we had the exploratory committee back in 2020. In 21, we had campaign feasibility study findings presented. In 21, we also had a memorandum of understanding with the YMCA to create the task force. We did that. November 16th, of 2021, we had a meeting where we presented findings of where the YMCA should be located and a concept design plan. And then February 15th of this year, Commissioner John O'Connor made a motion to approve the YMCA at the Great Mills site as presented from the YMCA at the previous meeting, and all 5 commissioners were present and voted yay on the motion. And so here we are today.
Thank you for having us. That's exciting. I appreciate you sharing that. So since the last time we were here in November, the directive was given to go back, work on costs and schematics for a building as designed with the pool, and then a cost structure with a building that didn't have the pool. And so Brian and his team have been working on that, and we've been able to pull a variety of cost estimates and data, not only through the Ys that we've recently built, but also a Y out in Urbana as well. And so we're very comfortable with kind of where our numbers sit. And so I think what we'll do, if it's okay with you, is Brian will kind of lead us through the presentation, and then we'll answer any questions you guys may have.
Okay.
Great, excellent. Next slide, please. And one more, please. So thank you all for having us. As Robbie shared, really delighted to be back in front of you guys today. We'll chat a little bit about the plan. We'll look at the floor plans a little bit, and then one more. We'll kind of talk next steps. So as Robbie mentioned, we went back after the last meeting. We put some detail into the plans. We brought them into a schematic level. We got those plans priced by a company out of Chestertown, KRM Construction, who we felt was the best candidate to price that, given that they had just built the Kent County YMCA. We looked at those numbers with a fine-tooth comb and made any slight adjustments that we thought that would be applicable to the St. Mary's County site, and benchmark that against national-wise around the country that we've been seeing recently. So we do feel very comfortable with the numbers. We'll share that today. So just as a reminder, we're looking at the Great Mills site. Final placement of this building subject to site civil engineering, certainly taking into account utility placement, grading, et cetera, but location preference for the YMCA is really pretty close to the existing Great Mills pool to be able to share parking, share some infrastructure, and share programming between those sites. Next. We took the detail in these floor plans, we detailed these out. This is the snapshot of that. There was about 25 pages that went into this schematic design set that was supplemented with a design criteria of about 350 pages that went room by room of what we were looking for, what's the grade of flooring in the gym, what's the pool surface, et cetera, to get to these numbers. Next slide. So you're seeing the first and second floor in here, and then the next one was we removed the pool. And what that was showing was, we're not really changing the scheme, because we know that even if we don't include the pool on day one, we may want to in the future, and the flow for these buildings is meant to expand over time. So The next slide, please. Just looking at what that saves from the cost of construction. It's about 7,500 square feet for the pool tank as well as the mechanical systems. And you can see a little bit into Studio B that would be impacted if we were to remove some of that space. Next slide. And then the renderings that we were looking at, of course, all of this is subject to planning and zoning review, architectural review boards, but we like to cast the vision of a highly visible contemporary YMCA that takes advantage of the landscape context and the views, as well as visibility both in the building and outwards towards the building. Next one. Focused on social gathering, in a safe environment, inclusive for all, ensuring that we have a variety of offerings that fills in the gap from 6 weeks old to 106, and that the Y can mean something different for everybody, but it is a place for all to be in there to fill in the gaps. And as you guys saw when you went through the Kent County YMCA, a lot of similarities. So I think when you look at those facilities, we have to be good stewards of the community's dollars. And so what we look for in impact is a really efficient layout, good use of materials, but nothing in there is, going to be mistaken for being at, a high-end hotel or something. They're very common materials that are just arranged in a way that is impactful and engaging for folks. So as priced, we were at about 51,504 square feet. That includes a full-size gymnasium with the walking jogging track, 3 group exercise studios, about 7,500 square feet of fitness area, as well as all the youth and community areas, including community kitchen, teen intergenerational center, and our Child Watch kind of youth development zones within there. Next slide. So when we got into the cost, we took KRM's numbers. We broke them down on a square footage basis. That's essentially how we benchmark these, because we know that the costs in Lexington Park are going to be different in Wichita, Kansas are going to be different than San Francisco, California. But on a percentage basis, we tend to spend the same amount on things like steel and concrete and finishes across the country, whether that cost per square foot is $500 or $200, right? So when we looked at that, we were shaking out to about $265 a square foot. That's right on par with the national average right now of what we've seen, unfortunately, with over the last 2 years with escalation, inflation, and supply chain issues. But we feel really comfortable with that number. So when you look at just the building itself, without the pool, it's about $15 million, which includes contractor markups, insurances, contingencies, et cetera. The site work number is assuming that we can tie into existing utilities, within the Great Mills Pool region. That might vary one way or another if you have to do a new tap into the sewer line and things like that. But that seems relatively reasonable for what we were looking at. And then adding the pool is about $3.4 million, which is essentially the cost of the enclosure of the pool as well as the pool tank and mechanicals. And that's pretty in line with the national average for what's essentially an 8-lane wide pool, so about 60 feet by 75 feet, subdivided in, could be 6 lanes, could be 5 or 4 lanes with splash pads and alcoves within there. Soft costs add another $2.5 million. That's architecture fees, FF&E, which is furniture, fixtures, equipment, branding, computers, things like that. So grand total without the pools about $17.6 million, and with the pools just under 21. Now, I always say in this stage of the game, there's things like design and estimating contingencies in there. There's construction contingencies that are, probably totaling about 12%. We're also carrying 1 year of escalation of about 5% in those numbers. So ideally, could it be, 5% less? Sure. Could it be 5% more? Depending on the market, we don't know. What we do know is just over the course of what we've seen in the construction market over the last several years, these costs are escalating at about 5 to 7% per year. So, pushing this another year or 2 years, I just have an inflation cost roughly $1 million. So if we were to break ground 4 years from now, 3 years from now, there is a cost factor that comes from that. Now, that doesn't also take into account some restabilization of the construction market that could say, maybe we'll get lucky. But I'm not going to gamble on that right now. So that's essentially where we landed with that. We feel good with the numbers. We feel pretty confident with where that lands. We benchmarked against, obviously, the Kent County YMCA, which was a GMP, guaranteed maximum price, about 18 months ago. That's been escalated about $20, $25 a square foot since then. And then the new Y in Urbana, Maryland, Iamsville, actually, escalated out. That was a GMP in early 2020, opened in April. Escalate that out. That was about $270 a square foot when we came into it. So happy to take any questions on the budget.
Questions, anyone?
No.
Okay,
Great.
continue.
So in terms of next steps, really at this point in the game, we put our pencils down and really allow the funding blend to catch up, right? Which means we don't want to hire an architect to go out and start drawing a $21 million project if we think we're going to have 19 or 20, 0.1, because we're wasting money, right? Because then we have to pay them to draw it again when we need to bring it into budget. So the first thing we do is obviously a go, no-go. Is this something we want to pursue? We let the funding plan, the capital stack catch up where the dollars are coming from within there, at which point we really look at project team formation, which is hiring a local architecture team. And when I say local, it could be somewhere in the state. I don't think you want to go outside of Pennsylvania, West Virginia. We have a lot of great, talented architects in the state of Maryland in here. Hiring the construction manager or general contractor formally, I prefer those folks at the table at the same time, doing a construction manager at risk. But, obviously the county has certain guidelines in terms of RFPs and things like that, of which you can, there's many different ways to slice it. But forming the local team that will take the documents from the current state and basically put them into a permitting format, construction documents that can be bid locally, at which point you're looking at construction, somewhere, 9 to 12 months from now. If you go to the next slide, we'll share the timeline. So we're pretty much finished up with the boxes that are in magenta. The yellow's kind of in that, in between funding phase. And then from there, what we'll do is we'll have that repriced by the selected party, refine the schematics ever so slightly, and then get into the design documentation, construction documents, permitting and approvals, bidding, and finally construction, which we think will take about 14 to 15 months. So long story short, starting tomorrow, you're looking at about 2 years to be open with the center. So.
Let me just interject something real fast. This 12 months before starting constructions, I think is very important, because we've talked about if we can qualify for earmarks or qualify for some kind of state money, some kind of grants to help. They talk about shovel ready, and that's been talked to be 12 to 14 months. So I'm glad to hear 12 months. Now, you indicated back in November that a lot of times your schematics can almost be qualified as shovel ready. What's been your experience with that?
Yeah, I mean, definitely we've for a lot of new market tax credits, federal earmarks, you just have to show us a certain level of completion, because most of the time these entities want to know that the project is real. And so the upfront commitment that shows that, the planning that goes into it, the sources and uses is usually enough to start that conversation. Now, sometimes when you get the architect on board, you might have them go through design development, which is essentially taking our plans, putting some engineering to them. But even then, it's no more than really a month or two of work to be able to get to that point. No. But we've had very good success using the drawings that we've produced to qualify as shovel ready.
A couple weeks ago, Commissioner President Guy and I went to the Chestertown, and very impressive facility.
Thank you.
And that's kind of what you see happening here, right?
Yes.
So I guess my thought process is you're not reintroducing something new. You've already got a proven model. I've been involved with a company called Sheets and AutoZone, and what they do, they pour it out of a can. When they come in to do something, they know everything they need. So with that said,
space allocations are different. This Y is going to serve twice as many people as the Y in Chestertown. And so when you look at, there's another group exercise room, bigger spaces, larger wellness areas. So the reallocation of space is really tied directly to the market study.
That's where I was going. I saw this thing about 14,000 square feet versus 7,200 square feet.
Right.
So you're recommending the 14,000 for us, or the 72?
Well, right now, under the current schematic, the large double gym isn't in the design. So we reallocated space to make sure that multiple purpose spaces for programs and the wellness area was large enough to accommodate 8 to 10,000 people.
Okay, so we're not giving anything up if we don't go with the 14,000?
Correct.
It's just a little smaller gym, right?
Yep.
Okay. Now, my next thing is, and I'll ask you to expound on this, we, of course, have our own procurement department, and I'll use a term, it can be cumbersome sometime. We have rules, but we've done things out of the box, per se. When we got a grant a few years back, and we gave it to the Navy Alliance to let them do the actual construction, because they were a little bit more nimble, and they were a little quicker. Now, do you have that same capacity with, your experts, your people you've used? I think it's better to use people who have already been doing it versus bringing in people who have to learn it.
Yeah, we're not tied to the same procurement processes that you are, and so when we look at building an architectural team and connecting our general contractor to where they're all at the table at the same time, to Brian's point, we've had tremendous success at that, because if you're going to find ways to, for lack of a better word, value engineer and make that facility as efficient as possible, you want to get those teams together as quickly as you can. And so, to date, every Y that we're in, we've built, even Y, like the Y in Queen Anne's County, that will have a Queen Anne's County Senior Center in it, the YMCA in St. Michael's that has a Talbot County Senior Center in it. The Y led that process for numerous reasons, but mainly in that we were able to navigate that process with maybe a little less red tape.
Okay, leads to my last question at this time. If we were to turn this over to you guys to build, obviously we have the accountability to the taxpayer that we can build it for whatever we think we can build it. I heard your points about escalating and this and that, and last thing anybody wants to talk about is cost overruns. So are there any safeguards built in that if we get involved in this kind of relationship, that we don't have to have cost overruns that we didn't see coming?
Well, I think if the county builds it and it's a county-owned facility, and the Y is raising money as a part of supporting that project and paying for it, if there's overruns, it's on the county's dime because it's your building.
Suppose you build it.
So if we build it, I think what we would need to do is come to an agreement around, to Brian's point, what the funding model is. If there's cost overruns past that isn't entailed with you saying, I want a 10,000 square foot bigger building, the Y would be on the hook to make that happen. We would keep you in the loop, obviously. It also, a lot of that boils down to timing, right? So if we're 4 years down the road, we're going to have to go back and price and see what that looks like.
Yeah, the process that we found that works the most effectively is that construction manager at risk with the guaranteed maximum price, because from the Y standpoint, there's no going back to the well to get more funds. We have $15 million and that's it. And it doesn't help us if we save $500,000, but it hurts us if we spend over $500,000, because if we saved $500,000 by going out to a design bid build, we would have spent it anyway. So when we look to select the CM, pay for pre-con services, which is them sitting at the table, pricing this with us along the way as we're designing it, their job is to keep that in track. And at the end of the design process, the contract is a guaranteed maximum price. If it's $1 over, that's on them, right? And there's contingencies built in there for escalation and some things like that. But by the time you get to that point, the contracts are locked in, the material's purchased, and you're good to go within there. That does traditionally fall in line with county requirements that everything's bid. So what you would do is bid the construction manager first, put 5 to 7 firms against each other. You're going to judge them based on overhead and profit as a percentage of the cost of construction, pre-construction fees and general conditions, the cost per month to build the building. Judge all that, hire that person, do the same thing with the architect. They design and work together on the building. If it's 20 million, we got 20 million, that's the goal. We're all making decisions, all in the same room, open book. And by the time we get to the bidding process, you're not necessarily bidding one party that's bringing all the subs in. That one party that's, contracted for 5% of the cost of the project or whatever is bidding out to the 30 trades. And it's their job to pick, HVAC contractor A, because their number's a little bit better, HVAC contractor, or, plumbing contractor B that's got a little bit in line to deliver that project in there. So it's been very efficient for us. We do it on 98.5% of the Ys that we build across the country. And to your point earlier about procurement networks and things like that, we lump all Ys under one pot. That's not to say that all Ys are the same, because they are vastly different and they reflect the communities that we build in. But the gymnasium, the game lines of basketball don't change whether you're in Maryland or Indiana or California. They're all the same, right? The flooring, might come from one manufacturer or another, but we want to treat Ys when we build these that you're getting the benefit that you do have for sheets that are building 100 buildings, because we build about 50 a year. So we're buying Sherwin-Williams paint at $45 or 45% less. We're buying tile at 30% less, because we're looking at bulk contracts within there, and that only is when it makes sense, to bring the cost down. If we can get local sources that are just as good and better quality or less cost, then by all means we're going to do it. So it's been a good system. We open a new Y about every 3 weeks, and we're constantly trying to drive down the cost, because these buildings are very impactful. And if we can design a building the right way, as Robbie mentioned the last time, the goal is really that nobody's turned away from a Y based on their ability to pay. And it comes from, the upfront cost, what you spend to operate it, and how efficient your business plan is.
Anything else, Commissioners? No?
Sounds good.
What do you need from us?
Yeah, so I think to Brian's point, the next real step would be, are we a go or a no-go? And if we're a go, which you guys voted to say we were a go, and that's super exciting, the next step is us working together to develop what our funding plan looks like. And then from there, I think there's probably some other questions to answer around who's going to build it, who's going to own it, what's the relationship, some small, some more in the weeds questions around what's the relationship with the current facility that's there with the new YMCA, just some stuff like that. So probably another meeting, maybe in closed session, to just hammer out some logistics. But outside of that, that's really the next step, is go or no go, and it sounds like we're there on that. So now it's really working together to figure out what the funding model looks like.
One last thing. This thing gets built, and for some reason, or we don't know who, you guys are running it, and it gets tore up, demolished, it gets run down. What's your contingencies to avoid that?
Yeah, I mean, you saw the Y in Chestertown. We're not, we're in it to win it. We've hired Tony Sigmund, who's there. Wave, Tony. So Tony's our Vice President of Financial Development, longtime Y colleague of mine, 34 years of experience on the Y. He's helping us with fundraising in Queen Anne's County right now. We've seen some escalation in that project. That project went from 16 million to 20 million. And so we're trying to button that up. If and when we're in a position to move forward here, Tony would relocate to St. Mary's County and would be our lead staff here, working with local volunteers, not only to raise the funds necessary, but then operate and lead the Y. Tony's been a CEO of the YMCA for 20 plus years. So the most important piece of it is you've got the right staff in the right place to make sure the Y is successful, and then you build a strong volunteer base around it. Being a part of the YMCA of the Chesapeake, we're an organization, as I've said before, that has been in existence since 1857. So we're not going anywhere. We're blessed to have an endowment that provides, it's about a $12 million endowment that provides some resources annually to ensure that the YMCA is not only financially sound, but able to provide financial assistance. So as you saw in Chestertown, that Y in 45 days has 3,700 members. There's only 5,000 people that live in Chestertown and 20 in the whole county. And if you go there, you see everyone there. One of our volunteers said, it was like our town was asleep and then the Y opened, and everyone woke up and decided to hang out together for the first time ever. And so that's possible because when you walk in there, regardless of your financial capacity, you're able to participate as a member just like someone who could pay in full. And so our model is designed in a way that it's the front porch of the community. We're designed in a way to make sure that we can sustain that work for the next 100 years. We're very fiscally sound in that we put money away for maintenance reserves every year to make sure we can take care of facilities. We've got a board of volunteers just like yourself that will be here long past my time as a leader, the staff leader of this group, that are brilliant individuals just like yourself that make sure that they are the Ys always positioned and prepared to meet any particular community need. So that's not an issue we've ever run into, nor will we, based upon the leadership that we have at the volunteer and staff level.
Again, what we've voted a couple weeks ago was financial detailed impact was $16.9 million. Remember, that's our number. So you need to help.
Yeah, I'm confident, that we can raise the $2.5 million or a little more probably in the community phase. And then we've had success at the state level. The governor is attending the ribbon cutting on Friday, March the 4th, and he's been a big advocate and supporter of the Y. And I think he would articulate, he just put this $50 million for economic development in rural counties. Are you the chair of that Tri-County Council?
I am.
Well, there you go. So logistically, when you think about job skills creation and community development, YMCAs can be transformational in rural communities. That particular pot of money in these 5 areas would be an area that we should look at. We're talking about it in Queen Anne's County and Dorchester County, because when you think about we've hired 60 people in Chestertown in the last 60 days. This Y will employ well over 100. It's a can't pick a better place to work, whether it's your first job or a retirement job or just a supplemental income. It's a way to give back to your community. And then the collective work the Y will do, and the value of the Y being here, which is something we've heard a long time around. How do we hold on to the folks that are here on a time-sensitive work schedule in relation to the base and this or that? The Y is going to create an anchor point or a community anchor point that will hold people in this county long-term. So when you think about economic development, the Y will be a benefit in that regard as well.
So I appreciate it. I think we're past the sales pitch at this point. We've
Sounds
voted.
good.
So there's that. Now from the risk management point of view, sitting on the Legit board, local government insurance trust, and believe it or not, the county administrator out there in Kent is one of my colleagues on that board, Shelley Keller. So I don't see why the county would want to own that building. The risk side for the pool would be through the roof. Not only that, but the building maintenance and everything else that would go with it, the utilities. Those are something that long-term it wouldn't make sense. If we're looking at it from a public-private partnership, that's where it would go. Commissioner Hewitt made, at least in my opinion, from the risk management side, I don't understand why we would get involved in that at all. Plus, I just think it becomes cumbersome and burdensome in the future. Who's going to fix what? How's it going to get fixed? And it just doesn't make sense.
I agree completely, sir.
So from that point, Commissioner Hewitt made the point, there's a capital improvement project sheet, and I think that our finance department is able to get with you, provide that, show you where the budget's laid out, and go from there. So what I want to avoid is the hiccup that it's back on the commissioners to yet make another decision. I think we've made a decision as a board. I think the funding is there, and I just want to hear what the next step from the Y is to make it happen. I know there's some finer details that have to be discussed, but
Sure. So I looked at the CIP budget that was in there from your meeting in February, early February. So you've got plenty of money that's allocated for architectural fees and engineering fees that will handle it. It's a little over $1 million. Last I saw there was maybe 10.3 in the CIP.
16.9, I think, as Commissioner Hewitt just said.
So if that number's there, then we're all good to go.
Okay, yeah. Our finance department can provide that. That's
What I would suggest, Commissioners, with your approval, is that my office get involved with Department of Public Works and Transportation and a procurement and finance office and possibly have like a Teams meeting or something in the next week or two with Brian and Robbie, and we start going through some of these details. And
That sounds good.
Yes, good.
Yeah, if that's in place, then we're good to go. Then we would go ahead and work from a Y staffing standpoint on our board approving this being a Y, part of the YMCA of the Chesapeake, and then our staffing strategy, working on, as Brian said with the chart, securing, bidding out, securing architectural firm as well as construction firm, and begin working on the process.
Well, after all this work, I really hope your board goes for it too.
100%. Yeah, no doubt. And some of those folks have gotten a chance to meet you guys over the years, and they know the impact the Y can have in the community, and they're supportive for sure.
One of the things I want you to keep in mind on the board of volunteers that you mentioned is, since this is going to have an impact throughout the county on the community, obviously pool being there, there's going to be school activities that are going to be involved. And the Parks and Rec Department for St. Mary's County, while you have board membership, I'd like to see that there's 2 allocated seats on that board as we navigate this for the Board of Education, a Board of Education member and a Parks and Rec member to be on that board to collaborate, whether it's ex officio or they're a voting member, however it is. But I think it's going to be important to ingrain them into the community effort that's a part of the entire county.
Okay.
And we're hoping your finance person here can generate more funds privately.
He's a superstar.
He convinced me last time we met with him he is, so we hope he'll come here and increase the private sector and help us out on this.
I think you'll find the excitement of y'all support at this level will absolutely help that process.
Great,
100%.
great.
Yeah.
We're hoping people out in the community will step up and work with this.
I have no doubt you got a lot of dedicated people in this community.
Yeah, and my goal is obviously there's money allocated in the budget right now that it's purely tax-based throughout the county.
Right.
If we can allocate those grants, get that earmark funding, lower the amount that's being allocated out of the capital improvement budget and still meet the goals, and then we can reallocate that money in our budget to other projects that are necessary in the county, it'd be much appreciated. Just think you need to get going where you're going.
No,
So-
absolutely. I totally agree.
Very good, very good. Any other questions, Commissioners?
No?
We thank you for coming today.
Yeah,
and
this
giving
was
us
great.
better information, and I think we're ready to move forward with this. We do
We're
appreciate
really
it.
excited. I'm excited to see this. It's going to be a great thing
We'll
for.
take you off the Eastern Shore for a while.
Sounds good. Y'all have a wonderful afternoon.
Thank you.
thank you.
Thank you.
Thank you. And next on the agenda is from the Department of Finance, Board of Education, request approval of fiscal year 2022 budget amendment. And Ms. Cudmore, and I see Ms. Ms. McCourt is here as well.
McCourt, yes, okay. Yeah.
Good morning, Commissioners.
Welcome, ladies.
Morning.
We are here with the Board of Education on a budget amendment to increase their food service fund by $1.5 million. And I have here with me Tammy McCourt and Megan Doran, who will go over the details. Thank you.
Good morning. Thank you for your time this morning. Just to provide you a little background, next slide, please. Free meals became available to all students at the beginning of the pandemic on March 17th of 2020. The USDA reimbursement is being provided on a per meal basis, whereas prior to the pandemic starting, it was provided based on our farms count, our free and reduced meals eligibility. USDA has increased the reimbursement rate effective the beginning of January 2022, recognizing the increased food and operational costs that we've been seeing locally. Per the USDA, this is a 22% increase as compared to the pre-pandemic reimbursements. We are providing daily breakfast, lunch, snack, and take-home meals to all the students. Next slide, please. Ms. Duran.
So going into this school year, we weren't sure what to expect with all students being back in the classroom and meals being free to all students. So as you can see, our breakfast participation has remained pretty level this year. Next slide, please. However, our lunch participation has increased significantly. If you'd go to the next slide, please. We also provide daily snack and take-home meals through the waivers through the USDA. Previous years, we have not been able to do this. They've only been at-risk schools, so it was area-eligible schools. So this year, we have increased, as you can see, very, very significantly. At the beginning of the pandemic, we weren't sure, what the participation was going to be. We were very excited to see so many kids participating. Right now, we are averaging around 9,000 students participating in lunch daily, which is a significant increase from previous years, which was around 7,500. So we have really seen great participation and are able to feed a lot of students. The take-home meals have been really beneficial for a lot of students, where in the past, like I said, they were only provided to students that stayed after school for at-risk programs. So we are able to provide those meals for the individual students to have the availability.
How does that work for in the schools? Do the students have to register in advance, or is it just every day whoever gets in line to get a lunch gets a lunch?
Mm-hmm. So a lot of schools do it differently. Our elementary schools, they do have like a lunch count, so the kids come in the morning, the teachers say, are you eating lunch today? They give the counts to our cafeteria managers. High school and middle school, it's different. They go in and get their lunch. It makes it very nice to be able to have the free meals available for everyone. For the students that forget their lunch, that in the past that has been difficult for kids that didn't have money on their lunch accounts if they were a paid student. Now they can come through and get lunch free of charge. So it does help a lot with those.
So every student gets a free lunch regardless of their income level or anything? There's no...
Take advantage of it.
Currently,
Everybody
every
does.
student is eligible, yes.
And that's for all meal periods. That's breakfast, lunch, and then also the take-home meals.
Wow.
Well, I mean, it's funded by USDA, right?
That's correct.
Well, I mean, why not?
Yeah, that's true. I don't
I
know.
move to approve the Board of Education's request of an FY22 budget amendment for the Food Service Fund in the amount of $1.5 million for funding from the USDA.
Second discussion. Just the only concern is what happens when the funds dry up, once students start to rely on this even more.
Well, at this point, the USDA is providing this for the remainder of this school year, so there's no concern with regard to this school year. We haven't received any formal communication with regard to next school year.
Well, you do get free and reduced meals that's a program that goes on yearly.
That's correct.
I mean, it's been going on, I know when I was in there back in Abilene.
When you go to school, it's 25 cents.
Yeah.
Probably.
Yeah. No, bottom line is that's been going on forever.
For lunch.
Thank God we got it.
Correct. So worst case, will we be reverting back to what we had in place before?
All right. Okay. So we have a first and second on this. All in favor?
Aye.
Aye. Any opposed? Ayes have it. Thank you all very much.
Thank you, Commissioners.
Thank you. Next, Commissioners, is item D from the Department of Finance, which is the award recommendation for asphalt overlay for current year 2022 with Brandon Hayden from Procurement.
Good morning.
Good morning.
We're here seeking concurrence to award calendar year 2022 asphalt overlay projects, which represents the second half of FY22 and the first half of FY23 projects. This process allows for our contractor to continue working on paving projects during prime summer months. The asphalt overlay solicitation was posted to the eMaryland Marketplace Advantage on December 22nd, where 310 potential bidders were notified of the solicitation. Additional bidders were notified by county website. No pre-bid meeting was held. One amendment was posted to answer questions and respond to requests for additional information. 5 bids were received before the bid opening date of January 26. We're here seeking award concurrence to Aggregate Industries in an amount estimated at $2,598,725 for asphalt overlay projects to be completed in calendar year 2022. Subject to receipt and acceptance of contract-related documents, as well as sufficient appropriations for FY23 projects, which will be encumbered to a purchase order after July 1.
I see a lot of these projects on here, and I'm supporting this, but I do wonder about how they get selected. Is it based upon the amount of traffic counts, or is it based on, because I know we have a lot of roads in St. Mary's County that people live on, and there's no sidewalks, there's only one lane, and then that road gets ignored, or those road gets ignored for a long, long time. And other roads that have sidewalks and have these, they get paved. It just doesn't make any sense to me.
Yeah, my understanding that's handled at Public Works, but I believe they rate the asphalt surfaces and repave based on the need and the wear of the particular roads and surfaces.
Well, I've requested a meeting with the new Public Works Director as soon as he's available to discuss these types of things.
So I see the 5 companies that bid, and looks like the last one was non-responsive, but they would have actually been the lowest cost one had they been responsive.
That's correct.
Actually, that's what I was trying to.
So they failed to submit proper bid paperwork.
I was trying to.
Won it.
Yep.
Where, and I'm sorry, I'm looking in board docs. Is it in a separate document? Because I don't see the companies that bid.
It was a confidential document.
Yeah.
There's a confidential one. It's probably not in board docs.
That's on the bid tally.
Okay. All right. Aggregate, where are they based out of?
Greenbelt,
All right, but their overarching company is,
they're a worldwide company.
right,
Have an asphalt plant in Waldorf.
right. Do we have any local companies? Thank you. Thank you.
They were also last year's service provider.
Right. Yeah, this doesn't have the list on it.
Any more questions, Commissioners?
I move to authorize the procurement officer to award the asphalt overlay services contract for calendar year 2022 to Aggregate Industries in the amount estimated to exceed $1 million, subject to receipt and acceptance of contract-related documents.
Second.
Have a first and second. All in favor? Aye. Any opposed?
No.
Ayes have it.
Thank you,
Thank you.
Commissioners. Thank you, Brandon.
Thank you, Commissioners. And the last item on County Administrator time is from the Department of Recreation and Parks for Legislative Bond Grant Agreement, Sports Complex RP 1904. Mr. Art Shepard presenting.
Presiding. Whoa. All right, I'm going to give you a brief timeline for this legislative bond grant agreement. So remember in 2019, we've been over this before, where we had the economic and market analysis for sports complex. That proved out to be a viable thing. Then November 4th of 2020, you commissioners sent a letter of support to this $150,000 for a grant. Then just this past December 7th, you approved the grant application. So here's the next step is there's a bond grant agreement, and you have that in your packet. That's what I'm asking you to authorize this morning. They were in touch with us again yesterday, wanting to know about the receipt of this. You're signing that, authorizing that $150,000. It's 2 years to have to decide if we're going to match the grant, and then 7 years to spend it, and all matters related to a potential sports complex. So I'm asking for your authorization of the agreement.
I move to approve and authorize the Commissioner President to sign the legislative bond grant agreement from the state of Maryland in the amount of $150,000 awarded to the concept design of the St. Mary's County Sports Complex.
Second.
Discussion. So we're not committed to putting money towards this grant. If we take this 150, do we, I'm looking at this 202. Do we have to spend additional monies?
Well, if you look at on page 1, number 3, it says grantee if they'll take it back, provide evidence of the required matching fund, which is none at this time, or no part of the project is under contract by 6/1/2028. Okay. But as we know, it's not used for a study, but $150,000, if there is an additional funds, aren't going to get us but so far.
All right.
So I look at this sport complex the same as I look at the YMCA now. So parks and rec and facilities for people to play. So one happens, the other happens. Now, hopefully it'll move forward.
Any more discussion? We have a first and second. All in favor?
Aye.
Aye. Any disapprovals? Ayes have it.
Thank you much. Appreciate it.
Thank you, Mr. Shepard. Next up is from the Office of the County Attorney, Legislative Updates, Mr. John Hauser presenting.
Good big packet
Norm
today.
Hauser, I got a big packet here. What's going on?
So I'm conscious of time, and I know I've said this before, but I will do my best to get through today with as much dispatch and more dispatch than usual, but we'll do our best here.
There was an old CW5 in the Army that I used to fly with, and every time he'd go out and do pre-flight, he'd say, "Brevity, gentlemen, brevity."
So with that in mind, I won't feel guilty if I just say a
15
bill's
minutes
name and
late,
move
so go
on from it. Starting off, the three main categories of bills we usually talk about on these. Tracking the status of the St. Mary's County Commissioner bills that the delegation move forward. Apprising the county commissioners of all requests for support or opposition of specific legislation we've received, either from within county government or from citizens or other outside groups. And then the third and usually largest category, just general legislation of interest. Very first one is the St. Mary's County Commissioner bills. No updates, no movement on any of those five. We do have hearings scheduled for this afternoon on the update to the Human Relations Commission language, HB 516, as well as changing the definition of a newspaper in general circulation for HB 523. Taking out the requirement that a newspaper needs to be distributed by sale for it to be a paper of record in St. Mary's County. Have apprised Delegate Morgan's office of the talking points on both. He doesn't, has not requested anything more. I'll be offering testimony on both as well. Just offer that in, but we will see where those go and move forward. I don't think we're expecting any difficulty with the human relations language moving forward. We have heard that there are questions that have been raised by staff attorneys up the road on HB 523, that there's going to be some resistance to that bill based on the belief that if we take out the requirement that it be distributed by sale, that's going to open up legal notices being legally permissible in very specific general interest publications. The example given was the real estate magazines that show up in every supermarket as an example. Looked at the language. I don't see it. I haven't seen the analysis from the staff attorneys on that one. Just that is what we've heard through the grapevine on that one, though. Check expectations now. Moving on for requests for letters of support/opposition. The first one to talk about on Memo 1 is the package of cybersecurity bills that we've been talking about for some time now. Director Kelly from IT raised the some flags on this one pretty much from the beginning of this session, that there's a number of legislative pieces making its way through that take local control on cybersecurity issues and centralize them in the Maryland Cybersecurity Coordinating Council and start implementing statewide standards. MACO has been working with Senator Hester and the other bill's various sponsors on this one. The position we're at right now is that MACO's universal stance on almost all these bills is that they support with amendments. They have not offered those text amendments yet, but I reached out with Dominic Butchko is the MACO analyst assigned to almost all of these, if not all of them. He assured us last week that bill sponsors have been receptive and they continue to anticipate major changes coming on this legislation. So the recommendation right now would be to continue our wait-and-see approach, taking MACO's representations and word that these promised changes will in fact be coming.
Good.
Next one is a request to support on SB 830/HB 1228, natural resources, oysters, spat, shells, and substrate. This is a request we received from Brian Height via Donna Sasser at the Agricultural Commission. Long and short of this bill is that it would repeal a tax credit program that's been in place for some years now for oyster shell recycling and replace it with a series of grants and other state funding towards oyster shell recycling efforts, substrate research. There's a subaquatic survey of subsurface oyster shells that's provided in there. The uptake of it is that Brian Height personally supports it. Donna Sasser believes that the watermen as a whole support it, though I have not received any communication from the local Watermen's Association per se on that, just representation of Mr. Height and statement that he believes these are the sentiments of the local watermen. I will note also that on this bill, Senator Bailey is a co-sponsor of it in the Senate, as are delegates Clark and Crosby in the House.
Okay, we need a motion?
We need a motion.
To support HB 1217, natural resources, oyster inspection and severance taxes and increase, and to approve and authorize the Commissioner President to sign letters of support to House and Senate committees for hearings on these bills.
If I may, we're
Discussing, or is that the next one?
That's the next one. We're Commissioner Morgan, SB 830 and HB 12.
830, 1228.
Well,
Back and
Well,
rescind that.
I was going to say I'll second it because I think there's support for it anyway.
So I'll start, let me do the first one. Let me take care of Mr. Height's bill. I move to support SB 830 and HB 1228, natural resources, oysters, spat, shells, and substrate, and approve the unauthorized Commissioner President to sign letters of support to the House and Senate committees.
Second.
Have a first, second, all in favor? Aye. Any opposed? Ayes have it. Next.
All right, next one is HB 1217, also dealing with oyster harvest. This request was also received from Brian Height that, again, the information and communications suggests that the local watermen are in favor of this one, but don't have anything more than something from Mr. Height and a personal respect on that one. This one takes the export tax that is levied on oysters shipped in the shell to any place outside the state from 30 cents to $1. It increases the severance tax on oysters caught within natural oyster bars in the state of Maryland from $1 to $2 per bushel, and then requires that a certain portion of the increased tax revenue generated under these tax increases be allocated to each state that has commercial oyster harvesting operations.
I don't quite understand this one. I just don't understand it.
Candidly, there's no fiscal and policy note on this one either, and requests for more information or on a clarification from the watermen on this one have not been answered. I do have from Ms. Sasser that they do quote-unquote support this and consider it a tax on themselves, but it's actual dollars for dollars fiscal impact on the county and how much money St. Mary's County in particular would stand to receive under this. I do not have those figures handy or accessible to me.
I don't understand completely. I do know that there is a major impetus for the lack of shell, and there has to be a way to get it. There's a Manicocre something up in the northern Baltimore County area that probably has more shell than you could ever imagine to replenish our beds.
All of our
However,
beds.
Baltimore County refuses to let them take the oyster shell out to replenish oyster shell in the bay to promote the growth of natural oysters, which is just that's a problem up the road. And I can tell you the Delmarva fisheries and everyone are livid with the fact that they can't get enough substrate to put down to get the spat, yet it's all sitting there, and Baltimore County doesn't want to let it go. So Brian I've known for a number of years. He's one of the local watermen who lives down your way in your district. I'll put that down 235, and I think he's doing everything he can with the local watermen to support natural oysters.
Right.
Water.
Okay.
And this is trying to prohibit oyster shells from going outside the state to somewhere else because I put a higher tax on them. Trying to keep the shells locally and distributed locally.
Okay.
I move to support HB 1217, natural resources, oyster inspection, severance taxes increase, and to approve and authorize Commissioner President to sign letters of support to House and Senate committees for hearings on this bill.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it. Next.
Next request is a request to support HB 1019/SB 838. This would be a straight budget increase in the amount that the Maryland State Department of Transportation increases for funding for elderly and handicapped transportation services for county emergency services. This request was forwarded us by Allison Swint at our local Department of Public Works and Transportation. The Transportation Association of Maryland was requesting the department's support and testimony on this bill. We, of course, sent it to you. Ms. Swint did note that the money that we receive from the state currently for these services is $131,052 annually, and that has been stagnant for approximately the last 2 decades. And this will be the first enhancement of those funds received in that time.
I move to support House Bill 1019, Senate Bill 838, Transportation, Elderly and Handicapped Transportation Service, County Funding, and to approve and authorize Commissioner President to sign letters of support to the House and Senate committees for hearings on these bills.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Next. If she desires, I presume there would be no complaint from the commissioners if Ms. Swint desires to testify in support of this bill.
How about it?
Yeah, how about it?
Next one, HB 1187/SB 726. This is a reallocation of state highway user revenues from the gasoline and motor vehicle revenue account. This would increase the local county's share of highway user revenues statewide from 1.5% of the current revenues from that fund to 3.2%. The request was received from MACO on All Points Bulletin, requesting every county's support and testimony in favor of it.
This is probably our best chance of getting an increase in our highway user fund ever.
I move to support HB 1187/SB 726, Transportation Highway User Revenues, Revenue and Distribution, and to approve and authorize Commissioner President to sign letters of support to House and Senate committees for this hearings on this bill.
Second.
Discussion. With the price of gas going up, Lord knows, we got to be collecting more on higher user revenues. Have you guys at MACO seen anything on this?
So
Go ahead, please.
I was only going to say that I'm not aware of the figures myself, and I'm thumbing through looking for the fiscal and policy note to see it, but my expectation would be I doubt that we're able to estimate what the actual increase would be.
There's a number. I'll be testifying on that bill at the Senate next week. And Commissioner Guy will be talking the video on the Zoom on Thursday. There isn't a number because we don't, as you clearly point out, the price of gas is going up astronomically now. And then you also have the issue of electric vehicles. And the argument that's being made now is, okay, you want more electrical vehicles on the road. They don't use gasoline, but they use the road. Sure. So what are we going to do to have electric vehicles pay their fair share for highway user revenue when they're not using gas?
What's the answer?
What?
What's the answer?
Well, the answer we got from...
And there's no answer up there except that we want to be green and we want to have electric vehicles.
Yeah.
But it's also inflation.
The only answer we got from we had a briefing from the
Which-
Department of Defense last week at MACO, Mr. Ports. And I asked him that statement. I said, what are you doing about electric vehicles? And he said they have a panel that's looking at it and it's reviewing it, and they don't know what they're going to do yet. But I know that there's companies like Amazon who's ordered thousands and thousands of new electric trucks to do delivery.
Hertz has too?
Yes, thousands. So he said they have a commission looking at it. That's all he said.
The gist of this bill, it's an election year bill, and it has numerous supporters from both the Republican and Democrat sides of the House, and both the House and the Senate. This is, as Commissioner Guy said, our last chance, particularly to go get this highway user revenue back and being able to double what we get back from 1.5, what did you say, John, 3.2?
3.2%.
Yeah, so we double. It's clearly in our best interest to go and support this.
Good.
And we'll get it back while there's plenty of money, and they'll take it away in a couple of years when things dry up.
You know, you got to take what you can when you get it.
Take it right now. Take it, but you can right now.
Strike when the iron's hot.
Yes.
Because the president, actually, Hogan's been trying for years to do something. It just hasn't worked.
Yeah.
Right.
So this is our best chance. We're both testifying next week on it. Okay, I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Next three requests for support come to us from the St. Mary's County Farm Bureau. First one up is SB 497/HB 592. This would allow, in my notes, I refer to this one as the deer slaying bill. Under present law, St. Mary's County, on private land, you are allowed to cull deer all season, all year long with the shotgun or breech-loading center-fired rifle. This law would expand that permission to land that is state land leased for agricultural operations to private citizens, and would allow them to have the same discretion or lack thereof towards deer year-round. The idea being that the more deer that are targeted or culled through this bill, the less damage there would be to agricultural
So
crops.
it'd be, for example, Newtown Neck?
I would think so, correct.
I would think so, yeah. Yeah.
I move to support SB 497, deer management permit, hunting on state land leased by permit holder. Authorization and to approve and authorize Commissioner President to sign letters of support to House and Senate committees for hearing on these bills.
Second.
I have a first, second. All in favor? Aye. Any opposed? Ayes have it.
A nice little tongue twister on that one, by the way.
The next two bills are very similar to each other except for one difference. They are key difference. They are SB 582 and HB 956, Natural Resources, Recreation on Private Land, Hunting. SB 582 is sponsored by Senator Bailey. What it does is clarify and put in statute the existing practice and law in St. Mary's County, which is that if a private landowner invites a hunter to come onto their land and again, without charge or without deriving any economic benefit therefrom, keeping the legal definition of a guest rather than just an invitee, then the property owner does not have any liability concerns from the actions of that hunter unless, again, the private property owner acts maliciously or profits from the hunter's actions by going on there. Senator Bailey's codifies and sets out that existing law. The House equivalent of the bill that is filed by Delegate Clark goes a step farther and changes existing liability law by saying that that legal status is conferred with or without charge, so that even if you are charging a hunter to come onto your land, if you are profiting from their entrance upon your property, if they're satisfying the legal definition of an invitee as opposed to a guest, we are still, by statute, obviating the property owner from any liability in a negligence or any type of other civil action that could be brought against the hunter by virtue of the private property owner allowing them onto the property and carrying out their activities then.
So just a quick question on this one. Well, I think it's logical to say, wouldn't that person then be conducting a business? If they were to charge them, then would that not be applicable to a business license through St. Mary's County if they are charging hunters to utilize land in game hunting?
Correct. So as I look at it legally, and again, looking at it from a just basic black book negligence, and what are the responsibilities and duties of a property owner towards folks they have on their property or bring onto their property. Once you start to derive a profit from it or derive financial gain or charge people to come onto there, you take the liability you implicitly accept raises much more than if you're just inviting someone to come onto your property and use it as they would, but not deriving any direct financial benefit from it. So this would be the equivalent of changing that liability law on businesses for this very limited circumstance of folks inviting hunters to come onto their property and hunt on it.
I don't see anything wrong with it.
Yeah, I just worry about the mechanisms in place.
So we're saying the farmer has no liability if this individual.
Correct. So we're saying
he is
that the
totally
farm-
liable for his actions on that property.
Correct.
And even if he pays the farmer a fee yearly to hunt on it, he's still liable for his own actions.
Right, that they are presumed to.
Right.
Right. And again, that is only in the House version of the bill. The Senate version of the bill does not grant
Does not say anything about the payment of, yeah, I see
Correct.
that.
Keeps
yeah.
the status that this only applies to situations where a hunter comes onto the property without charge. So the Farm County Bureau has requested support on both these bills, but they're seeking two different outcomes.
But if they both pass, they'll compromise on it somewhere.
Yeah, I guess it's a separate mechanism then at that point, meaning the business license. So the business license is aside from the actual liability end of things. So basically, it doesn't matter whether they have a business or not, then that business holder, right, if they're obviously goods for in exchange for a service or whatever, money in exchange for a service or goods, whatever you want to call it. So now that business owner, would they still have to meet all the requirements from the county for insurance? It's just saying that it doesn't matter what this person does on their property at this point?
Yes, looking through it, I'm trying to think that one through. Looking through it, I don't see where this would affect any other requirements that the county might issue upon it. This is just obviating state common law, state approach to the doctrine of negligence in general, and shouldn't impact and doesn't have any effect upon any county regulations requirement for a property owner to carry insurance, to carry on a business license before they start profiting from that activity.
Okay, so there's no impact to that.
Right. I see this as only affecting how the state would state courts would treat a negligence claim brought against the property owner.
Thank you. I move to support Senate Bill 582 and House Bill 956, Natural Resources, Recreation on Private Land, Hunting, and to approve and authorize Commissioner President sign letters of support to the House and Senate committees for hearings on these bills.
Second.
Have first, this for 582, right?
I read them both, Senate Bill 582
Both
and
the
House
same
Bill.
in written, as far as the motion?
Looks like.
Yes.
I'd expect, yes, one motion ought to cover both, I think.
Okay. Motion to cover 582 and 956. Have a first, second. All in favor?
Aye.
Aye. Any opposed? Ayes have it.
Next one, just to keep all of the requests for support together, jumping over to Memo 2, HB 633/SB 933. We received this request from Delegate Clark's office, and this would require change the membership of the Accountability and Implementation Board for the Kirwan Commission and implementing the blueprint for Maryland's future. Presently, there are it's a 7-member board on that, overseeing that process over the next few years. There is no representation on that board from Western Maryland, Southern Maryland, or Eastern Shore.
There's 5 members, correct?
There's 7 members, 4 from...
5 big counties, like 2211 or something like that.
It's 4 from Montgomery County, 3 from Baltimore City, 1 each from Baltimore County and Anne Arundel
Baco
County.
was really, the rural counties voted very heavily against this bill for lack of representation.
Correct.
We did have a voice vote, and the rural counties had Mako oppose the bill.
And how this bill would address that problem, it would require that 1 member, it would up the membership of the committee from 7 to 11 members, and 1 member each would be required from Western Maryland, the Eastern Shore, and Southern Maryland, and then 3 as a whole can be drawn from Anne Arundel County, Baltimore City, Montgomery County, Prince George's County, Baltimore County. More could be drawn from those counties as well, but at least 3 would have to come from those 5 largest jurisdictions.
Make a motion on that?
I'm trying to find where it is here.
It should be motion number 8.
That's 640 and 1426, correct?
640, HB 1426.
Yeah, I move to support with Mako amendments, SB 640, HB 1426, primary and secondary education, maintenance of effort requirements, alteration.
Oh, I'm sorry, wrong one. That's the wrong one.
Okay. Is this,
168, is that what you're talking about?
we skipped one, that's why it's throwing us off.
633/SB 933.
Yeah, we skipped one, so. All right, I move to support HB 633, Senate Bill 933, Education, Accountability, and Implementation Board membership, and to approve and authorize the Commissioner President to sign letters of support to the House and Senate committees for hearing on these bills.
Second.
Thank you.
Have a first, second, all in favor?
Aye.
Aye. Any opposed? Ayes have it.
All right, those are all the bills that we've received from outside the county attorney's office, requests for support or opposition. Moving on are the bills that either are updates from where we were last week or previous meetings, or that we have flagged as perhaps being of interest to the county commissioners.
Okay.
The first one, up back to memo number 1, is HB 1068/SB 113. This bill, as originally formulated in SB 113, would have required Maryland Department of Environment to set up an online tracking system for all septic system permits statewide. Counties would have been required to report into that system, and also had some language on statewide standards being implemented and applications having to be acted upon approval or denial within 2 months. That received opposition from Mako. There was a working group that addressed some of those problems. The cross-file HB 1068 addresses much of those problems. There's no require to submit in this or to participate in this online application tracker anymore, and takes out most of the more onerous obligations that this law would have placed on localities.
Just a quick question. There's 3 motions sitting on my screen, and we've moved on to the informational purposes. So I don't think I missed the behavioral health ones, SB 637, House Bill 1243, and there's another one, the motion that I read about SB 640 for the maintenance of effort requirements. So were they removed from our packet?
I believe that's memo number 2.
Okay, so they're just pushed in and not separated out?
No, there's another package that
There's memo number 2.
Well, yeah, I know. I'm just saying the motions aren't a part of the first briefing then, so they're just lumped in with everything else.
Right, and I think maybe where some of that came is some of these just legislation of interest did not anticipate the commissioners would be as likely to act upon as others. So some of these legislation, I think, have motions that we wrote out and prepared letters of support or opposition accordingly. Some are just in here for informational purposes only and don't have motions or letters of support already drawn up. That might be where the problem is coming from as well.
Okay, all right. Gotcha.
So turning back then to HB 1068 and SB 113, MACO opposed the legislation as originally written on HB or on SB 113. MACO now supports, without amendment, just flatly supports HB 1068. And Heather Moritz from our county health department indicated that she did that. Her problems with SB 113 were also addressed in HB 1068. So. We can issue letters if the county commissioner desire, or...
No letter.
No letter.
Which one are you on, John?
1068 and 113.
Memo 1. I would oppose this. It's more, even with what we heard a week ago, the amendments to try to make it more manageable, it's just another bureaucratic grab.
Try to add on, no doubt.
To, create another database, do more tracking. It hurts the rural counties particularly. I would write a letter that we oppose this bill.
You want to do a letter?
Yeah, I'd like to make a letter that we oppose HB 1068, SB 113, local health departments, environmental health specialists, and ongoing on-site sewage disposal system standards, regulations, applications, and funding.
So,
because MACO is opposing this bill.
Yeah, they would change.
All right, I'll second that.
All right, got a first, second on a letter for this HB 168, 1068, and SB 113. Got a first, second, all in favor?
Aye.
Aye. Any opposed? Ayes have it.
All right, moving on to the next legislation from memo number 1, SB 448/HB 685, dealing with an increase in the minimum library funding formula. This is a follow-up to a topic that came up during the commissioner session with Mr. Blackwell last week that we looked into. This bill would increase the state, the per capita allocation per student required under the state minimum library funding formula by a pretty substantial amount over the next few years. This is likely to have it will, if enacted, have a great impact on state funds that are provided under that formula. It is not anticipated, for my calculations, does not appear to have any effect on county allocations. The reason for that is that the state minimum library funding formula sets out a certain level of funding that each county library system should be guaranteed to have, set to a per capita rate. Of that per capita rate, the state the state minimum formula says that the state shall bear a certain percentage of it, no less than 40%, and the county shall bear a certain percentage of it as well. What the actual practice is in St. Mary's County and other jurisdictions is that the state provides their minimum amount, the county provides far greater than their minimum amount. True. So though we increased the minimum that we required under the formula, St. Mary's County is already providing per capita more funding than the increase to the minimum funding formula would require by, I think, 2030. It would increase state revenue that is
The long story short, and you're 100% correct in your analysis, is we would get a few more pennies per person based upon the formula, but since we're already funding the library in the terms of millions, we're on a per capita basis. St. Mary's County, on the sheets they showed us, is one of the highest funding library counties in the state. So it will have no effect on us as long as we keep funding the library to the current use. There are some rural counties who need this money because they don't have the resources to support their libraries. So this is sort of like a little helping them play catch up a little bit.
well, I mean, I think it would have an impact, wouldn't it? It would give 40%. So 40%, it would raise up what the state's contributing, and then we would be able to pull money back into the operating. So it would actually.
It's when you see the number on the chart that we showed to make it was really not very much.
It wasn't that much, yeah.
It sounds big. It came out little.
The fact is that we're already exceeding what the
Well, MACO
2030
supports
standards.
both bills, so it's
So it'll be an increase. I think Commissioner Morgan is correct. I don't think it's going to be, say, doubling the library's budget or what we'd otherwise
Right,
get,
right,
but it
right.
will be an increase from the state of what we already receive. And
So the gist of it is, I would say that we write a letter of support for HB 448, HB 685 education, regional resources, libraries, centers, regional resource centers and libraries funding.
Okay.
Second.
Got a first and second, letter of support.
Aye.
All in favor?
Aye.
Aye. Any opposed? Ayes have it.
the next bit I put on here was just a clarification of comments Mr. Blackwell made yesterday that said that state revenues were dropping, that they were receiving for library funding. We're trying to figure out how that is possible if the state per capita share is increasing. The answer for that is that the state's burden of that minimum library funding can be adjusted up or down depending on the county's relative wealth compared to other counties. It must be at least 40%. It can be more if we're dealing with particularly poor counties. In Maryland's case, state is picking up 44% of the guaranteed minimum, so only 4% more than what they would be obligated to do at a minimum. That is less than our relative wealth last year, so even though the per capita has increased by a little bit this year on the minimum funding, the state's share of that per capita funding has lowered by 7 cents per head, which comes out to a funding difference of about $6,000.
Which goes back to because we're funding the library so well, we're not penalized for it.
Right. Just a clarification.
Now, the question, though, was, I don't know if this was included in the supplemental budget the governor put out the other day. There's 2 supplementals coming. I'm not sure if this got put in, and I haven't had time to read the supplemental yet to see what all the intricacies are, to be honest with you.
So what I went through, and again, we have not had the chance to look into it either. We didn't see it in the supplemental budget from our review. Now,
Okay.
I will not represent that I have done a thorough or complete read-through of that, but it's not in there that I saw.
We realize it was put out there by Mr. Blackwell. Whether it was picked up by the governor is a different story.
Correct.
Okay.
HB 1243, the Rural Non-Emergency Medical Transportation Program. This would require $1 million to be set aside for hospitals to help coordinate transportation by a nonprofit organization to or from medical services for certain eligible individuals who may or may not be able to, who otherwise would not be able to transport themselves, not only to hospitals, I believe, but also to certain outpatient and other medical facilities, just allowing the hospital to act as kind of administrator and central clearinghouse for that program.
And I will, so I asked for this bill to be tracked. It is a big bill for the rural counties, particularly as far as medical transportation is concerned. The 5 tri-county councils are standing behind it. I'm not sure where MedStars, I called over there yesterday, haven't got an answer yet back, but the request coming in from the tri-county council statewide was to support the bill. It is sponsored by a gentleman from Anne Arundel County, and I believe it will be co-sponsored by a delegate from Charles County in the next day or so. But the letters of support are going to be necessary to get it through the House.
And the $1 million is coming from the state, not the local?
Comes from the state.
Correct.
What about the cost overruns? If the program exceeds that, are we now going to be entering?
This is called Wheels to Wellness. And it's a
Yeah.
program.
No, I'm very familiar with it, and I've seen it fail.
currently implemented and being very successful in St. Mary's County.
Well, I've seen it fail other places. That's why I'm asking, because of the cost overruns. So if St. Mary's MedStar is a part of it, and we have $1 million only from the state, but now are we going to be enter into negotiations with MedStar because their program's running 1.5, or what's the clarifications?
I don't know the answer to the question.
Right, and that's the problem, is that's happened. This program has been done throughout the United States, and the local government now ends up in a relationship with the hospital funding the overcosts of it versus it being clarified that the hospital will pick up everything after that.
That's why MedStar hasn't called me back. I don't know.
Yeah, that's.
So the Tri-County Council is asking for the 3 counties to support the bill.
I mean, I support it. I think it's great. I think there's going to be some logistics that need to be worked out.
Then I'll make the motion to support HB 1243, Public Health Rural Non-Emergency Medical Transportation Program.
Second.
Got a first and second, all in favor?
Aye.
Aye. Any opposed? Ayes have it. I think this is, discussion again about that, I think this is more or less for things like you got an elderly person who can't get to a doctor's office.
Yeah.
recall.
No, 100%.
We have some programs right now with Aging and Human Services that have volunteers. The problem is the volunteers been drying up. Had a hard time. So, I've got a great aunt who has to call me up to take her to the doctor.
All right.
So,
No, I think it's,
this is something
I think it's a great idea, but I want to make sure that we
other
don't.
than carry them to the emergency room, or even to the urgent care, it's just to carry certain people to a doctor's appointment.
Yeah, the populace surround this bill is not going to be the ones that are dialing 911 for
Right,
a
exactly,
bellyache.
exactly,
It's more so, like you said, the senior population. I just get concerned, that after that $1 million runs out, which it could quickly, who's on the
Who's on
hook?
right now, yeah.
Who's on the hook? So that's
Well,
what
we're hoping that after this COVID thing comes down, we got more volunteers coming back, but right now, they just don't have it.
Well, I do know in many cases, the grant programs the state has are covering Wheels to Wellness in St. Mary's right now.
Yes, absolutely, yeah.
Okay, John, you got it again.
Next one on Memo 1 would be HB 831. I would like to punt that for right now, because on Memo 2, we look at climate packages as a whole, and I think it can be brought up then.
Okay.
The next one after that would be SB 640, HB 1426, maintenance of effort funding for county schools. And this is a follow-up from our meeting on the 15th, in which Ms. Cudmore so graciously and so helpfully explained what this bill would mean. Long and short of it, as we may recall, is that it would be a change to the funding for the state to make, for county education system in the state, to make up for the anomalous decrease in enrollment we would have from the prior year as an effect of COVID. MACO's amendment to this bill, which came out between the 15th and now, is that they'd like to clarify that this is only going to be a one-time funding change and not allow it to be used as kind of a wedge in to decrease funding going forward.
One time.
Sent this over to Ms. Cudmore to let me know what I should say about it, and she said it looks good.
Okay.
Said what?
She said it looks good with the MACO amendment.
I mean, we've never underfunded them anyway, so I don't know what.
What they're concerned about is the per pupil student cost. That if we are short 100 students and 100 students come back next year.
And also the cost of student goes up.
They're going to double down on you. Maintenance of effort plus the 100 students at the per pupil spending ratio. I mean, they've always got a trick up their sleeve when it comes to.
I agree.
I know. Okay, I will make the motion to support with amendments offered by MACO, SB 1640, HB 1426, primary and secondary education, maintenance of efforts requirements, alterations, and to approve and authorize Commissioner President to sign letters of support to the House and Senate committees for hearings on these bills.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
All right, the next one on memo number 1 was just Governor Hogan did submit his $480 million supplemental budget. Put some highlights in it up there just as an FYI to the commissioners. The only other update remaining from memo number 1 was just an update on where we stand on the legislative redistricting lawsuit. Complaints were filed, scheduling conference was set. Argument is going to occur at the end of this month with a report by the special magistrate no later than April 5th. That tees us up if the Court of Appeals sticks to the same schedule it did last time in 2012 for a ruling sometime in mid to late April. And of note, it was brought up / threatened by the Assistant Attorney General marshaling this effort at the state level, that it is possible that the primary may have to be moved back from June 28th, depending on how quick an opinion comes out and how many changes it does. That, whether that's a valid belief, whether that is one of these things that lawyers say in zealous representation of their client to try and get the judge to go along with what they want, can't really say, but it is out there, and we bring to your attention. But for right now, June 28th remains the primary date. Moving then to memo number 2. This is where SB 637, HB 935 comes up. This would change health insurance requirements in the state to include certain behavioral mental health services that it does not as well. It would expand Maryland Medical Aid Program relief to these. It would also require current insurance plans issued and written in the state, public and private, to expand their coverage of certain mental health services that are not covered or are not covered in full under existing law. And we thought, and this was brought to our attention by some of the commissioners, and thought it may be of interest to the county commissioners, particularly in light of recent events here in Southern Maryland. and the interest that's been shown to this topic by the county commissioners.
Yeah, and I believe it implements the mobile crisis teams within this bill.
Yes.
Yes, okay. Yeah.
It's on page 2, the Mako testimony part.
Yeah.
Okay, I see it.
Is there a motion?
Is this for 637 and 935?
Yes, sir.
Yeah, okay, there it is.
I move to support HB 637, SB 637, HB 935, Health and Health Insurance Behavioral Health Services Expansion Behavioral Health System Modification Act, and to approve and authorize Commissioner President to sign orders to support the House and Senate committees for hearings on these bills.
Second.
First and second, all in favor? Aye. Any opposed? Ayes have it.
The next thing, not legislation, but an update of interest, is that Maryland has agreed to receive $395 million in its lawsuit against opioid manufacturers and distributors. That is, again, for county commissioners' information. 58 of Maryland's 60 subdivisions who participated in this lawsuit agreed to participate in the settlement. Where it will go now is Maryland will set up a plan administrator to take those funds and distribute them out to every county that participated and other towns and municipalities that are privy to the settlement as well. Those funds will be spread out over 18 years for the purposes of opioid crisis abatement. Summarize some of the other conditions that the defendants will have to abide by as part of this settlement, and again, brought it to the commissioner's attention because we figured it may be of interest. The very last thing that we put on memo number 2 then was I said we would punt HB 831. Climate change has been one of the central focuses of this legislative session, and there are a lot of bills out there, some of them offering very similar provisions, some of them offering competing provisions, and thought it may be helpful to just summarize to the best of my ability the legislation I could find that we're tracking or are aware of and putting it on there. The quick and dirty way to do this is that SB 528 is the single most largest piece of legislation coming through here. That's in pretty much omnibus climate change bill that is making its way through the Senate, and testimony was heard on the 15th. The House is not pursuing to achieve this through one piece of legislation. Instead, the provisions that are in SB 528 are split up over HB 708, HB 806, HB 831, HB 94, and HB 94. That's where you find the bulk of what is in SB 528. Mako is supporting SB 528 with amendments for most of the smaller legislation. I could find no exact or precise Mako position. Some of these things they are taking a stand on, not on this chart, but discussed previously was HB 695, the Better Together to Save Our Weather Act. That, for example, would require each locality and county to implement its own climate crisis prevention plan. Mako opposes that. For the most part, though, Mako is supporting with amendment, and I think could best be summed up as they accept that the political climate being what it is, some of this is going to make its way through. Mako's position is just do it with as much cognizance and awareness that some localities and counties will struggle to meet these requirements.
That's a very fair statement.
That's a very fair statement, no doubt.
Perhaps just of interest to pick maybe the most looming and things that have attracted the most maybe public comment on these. Among the other things that SB 528 and its attendant House bills would require are a switch from natural gas and oil energy and heating in public, private, and residential buildings. You have to begin phasing that out and start going forward. You have to have full electrification of building services unless you can prove that the social cost of natural gas and oil resources and the greenhouse emissions they would contribute to, that social cost is greater than the actual physical cost of implementing these problems or retrofitting buildings to bring them into compliance. There's a big push to move Maryland's public vehicles fleet to all electrified vehicles by 23, with only certain exceptions for light duty and other heavier vehicles than cars and trucks. There's also a particular emphasis on racial, economic, and socioeconomic justice and awareness. And there are some provisions calling for, as we do this, make sure an eye is kept on its effect towards underdeveloped or underserved communities throughout the state, and take everything with a lens towards not only looking out for the climate effect it would have, but also the racial equity and economic equity components of it as well. Any of these ones specific, I can talk about more if there's a particular interest to the best of my ability. Happy to look up more as they come up as well.
I think we've received notification from a local small business to oppose 831. I think that when you look at what these bills address, it's like the pendulum keeps swinging in different directions. And I'm afraid that sometime with these pendulum swings, they knock out parties that I vested interests in our county, particularly the petroleum industry, the natural gas industry. So I would recommend that we oppose HB 831 in order to support our local small businesses who do a great job of providing, fuel to residents in this county and have reached out and been there for years and years and years for us.
Yeah, this is the one that requires retrofitting existing buildings.
Exactly, yeah. That's what we were really opposed against when they said we got to retrofit our schools and everything else. Go do what? It would cost us millions and millions. Unbelievable.
One other distinction is HB 831 bears substantial similarities with HB 806. The difference is that HB 831 applies to residential and commercial buildings. HB 806 is applying the restrictions to public buildings.
So I don't, it's not cross-filed, and the hearing's already passed. So what would be the point of sending a letter?
The hearings are passed on both HB 831 and HB 806 will come up at 1 o'clock this afternoon. The reason they're not cross-filed is because they are parts of these
omnibus
are in that omnibus SB 528 bill. So there are going to be, I think, a slew of amendments and changes in conference committees on these bills, so there's probably still an ability to influence them.
So we can still
There's still much work to be done on.
We still send a letter of opposition against the bills.
I still think
Wouldn't we just oppose the whole?
I would not suggest you do that because that's going down a rabbit hole we don't want. Something's going to pass in Annapolis this year because that legislature is totally focused on climate change. That's one of their three big initiatives. Funding education in Kerwin, other programs, but I think that, 831, I think, hurts our residential building industry.
So does 806.
And I'm very concerned, when we are trying to grow, as we use looking at our property taxes to be a source of revenue, and then taking any type of fossil fuel component out of it, I think will hurt that industry tremendously locally.
Oh, I agree. Isn't 806 the similar?
806
that's for public buildings.
Right.
We aren't building anything publicly.
But 806
cause
would,
806
my
to
understanding is, would require retrofitting of public
Excuse me?
building. HB 806 would, I believe, require retrofitting.
Retrofitting also.
Right. So you'd have to why wouldn't we oppose that? Why would we want to retrofit?
I'm sticking with 831. That's the residential side. I don't think that 806 has, I really can't say. I just don't think that, the cost in our discussions at MACO for 806 to retrofit every public building, which would include schools, libraries, jails, et cetera.
All public buildings.
Yeah, there's just not enough money out there to
Even
pay
do
for
that.
this.
Yeah.
But I am concerned with 831 that would hurt our home building industry.
So do I have a motion to oppose HB 831?
Yeah, so moved, and authorize the Commissioner President to sign letters.
Second.
Okay, I got a first and second to oppose HB 831. Is that correct? All in favor? Aye. Any opposed? Ayes have it.
All right, and that concludes the legislative update for this week. Thank you very much
You've
for your
done
time.
a great job consolidating and synopsizing all the synergy stuff.
Yes.
The green stuff. You Congratulations.
I try.
You did good.
I understand now why my mother, growing up, quoted Chief Joseph when she said, "I shall fight no more forever with regularity." And
There you
her
go.
work.
So I did ask the county attorney for a specific request. I'm not asking that to be given to all the commissioners in reference to the law enforcement bills. There was Mako said there was nothing going on with it essentially. However, I would say that I think their opinion was off, as there's well over 40 different bills relating to law enforcement accountability and amendments to the previous Police Accountability Act of 2021.
Let me do, if I remember, the one that we've been paying particular attention to is 670, if there are going to be clarifications or if the standards and training that they're coming for.
So what they've done is they're not targeting House Bill 670. They're actually packaging individual pieces of legislation that alter House Bill 670 without addressing 670. For instance, body cameras, law enforcement officers being off-duty carrying an agency firearm would be required to wear a agency-issued body camera at all times.
Okay.
I mean, it's absolutely absurd. There's a couple other things with independent investigations, but I will impact the Police Accountability Board and will impact local law enforcement. So I'd just like to see what's going on with those bills.
I will do my best. And what I'll do is go back, do a search on just everything the Maryland General Assembly codes.
I have a website for you. It actually consolidates all of them, and maybe you can just give me an opinion on.
That'd be wonderful.
I'll get with you.
That'd be much appreciated.
Thanks. Yeah.
Thank you.
Thank you, John.
Back to you.
Are you done? Okay.
Sir.
Finally, okay. Let's go right to Commissioner time. I'm going to start with Commissioner Hewitt.
Oh, goodness. Thank you, Commissioner President Guy. Well, this afternoon, 1:30, we got a budget work session. Again, we're getting really into the meat and potatoes of this budget. We'll be talking about the Board of Education's request. This commissioner will support funding the negotiated agreement. That's it. I just want to make that up front. I don't want teachers to think we don't support them. We do. But there's a lot of fluff in that budget that Board of Education needs to explain. Secondly, SMETCO. Got my bill too, and it was a whopper. And I'll say this about it is, you know, when we have these storms come through and have these power outages, these people are out there, you know, night and day restoring that power. And honestly, I saw some Facebook posts about, you know, maybe this greed and the wrong time of year, and Lord knows there's all kinds of skullduggery thoughts going on. But I would say this, we're a co-op. We all own SMETCO. And I really think they're doing a great job. Do I like my almost double bill? Well, look, not really. But there's a lot of things going on in Washington and different places that affect what's happening. And all I can say is thank you for the good service you give us when we need service during those outages. And I really appreciate it. Every time I switch the light on, the lights come on. So thank you, SMETCO. Tonight, 6:30, we got our public hearing on the Police Accountability Board. Please show up. It's something new. It's new to us. It's new to, brought in last year by the general legislature. And the bottom line is we need to hear from you. Now, two good news things. I want to give a big shout out to Andrea Dyson. Andrea, I've known her probably most of all of her life. Her dad, Carol, and her mom, Judy, wonderful people. Carol owned Dyson Service Center in Great Mills for many years. He's passed on, and they were friendly competitors. But Andrea reached out to me and said, Mike, I travel Great Mills Road a lot, and it's gotten a lot darker than it used to be. She said, the lights don't seem to be working, and can you look into this? So what I did is I said, okay, so I got hold of SHA, Department of Public Works. Next thing you know, they found out 32 of the 46 lights on that road were not working. They were either burned out or the fixture was bad or whatever it took. 70% of the roads on Great Mills Road, from where the base starts there, Gate 2, out to Great Mills Road at Route 5 down at the bottom of the hill, 70% of those lights were out. They've all been fixed. SHA took it upon themselves to look at 235 and also Chances Run Road. to figure which lights are out there and fix those too. But thank you, Andrea, for reaching out. You made a difference to the way people's lives are for safety and feeling well about themselves and walking sidewalks at night. We've always heard Great Mills Road is a dark road and needs to be lightened up. You made a difference. You go, girl. Now, this Saturday, the 5th of March, from 2 to 5 p.m., the Hollywood Volunteers Fire Department's Ladies Auxiliary will be putting on the 61st Spring Dinner. Thank God spring is coming. And what we know is many of these firehouses have these spring dinners. Now, again, this one is going to be carry-out only. It has been that previous 2 years, and it'll continue to be the same. But it's going to be wonderful. It's going to be their stuffed ham, their fried oysters, their parsley potatoes, their all the stuff they throw into it. And those people work really hard to make these fundraisers come and give us the lowest tax rates we can get for our fire service tax. So please, Saturday, 2 to 5 p.m., Hollywood Volunteer Firehouse, come out and get your dinner. Thank you.
Thank you, Eric.
Very good. I'll second Commissioner Hewitt's comments. The Hollywood Firehouse, they do a great dinner. It's delicious every year. We're in March. March is Women's History Month, and there's a lot of women that get honored and studied throughout the month nationally, from women who have done a lot of great things, but it's important to look at the local women who've done a lot of great things. And yesterday, we were able to attend the retirement of Major Dietrich she's the warden was the warden of the detention center. She's had a phenomenal career, a groundbreaking career, and I just wanted to acknowledge her and give her a shout out, thank her for her service. It was an incredible ceremony to see that, and it's very fitting that we recognize it during Women's History Month. I also want to give a shout out to and congratulations to my pastor, Dr. Paul McPherson of Leonardtown Nazarene Church, on the completion of his dissertation. That's a lot of work to go into that. He's now a doctor, leadership, paradigm, and missional faithfulness and examination of adaptive leadership. And so he spent a lot of time writing that. So congratulations on that. Great work. Other upcoming events. Leonardtown this year is not doing their Earth Day celebration or beach party on the square. They're not shutting down the town. They're transitioning to more smaller events that will still draw a lot of people but not shut down the square. But the county is hosting the Cherry Blossom Festival again. That's coming up on Saturday, March 26th, 12 to 4 p.m. down in Lexington Manor Passive Park. You don't want to miss it. It's going to be a great time. So put that on your calendars now so that you can come out for that. Finally, I think it's fitting that we do acknowledge stuff that we have no control over, but stuff going on around the world, and the war in Ukraine. It's going to have impacts on us one way or another. Gas prices are going to continue to rise. The technology that we're seeing because of this war, they were able to see Russian troop movements through Google mapping and stuff. It's just incredible. And then Elon Musk putting up his Starlink network in order to get internet service there. Incredible. And it's a weird situation because we're watching this war unfold and we're not actively involved in it right now. And so we just need to keep in mind and keep in our hearts the Ukrainian citizens who are suffering, the Russian citizens who are suffering underneath Putin's regime. It's just not a good situation going on right now in the world, and we're going to see more impacts from it. That's all from me. Thank you.
John?
Thank you. Commissioner Colvin had some amazing points when we talk about the Russian-Ukrainian war that is currently going on, and the fact that we haven't seen this level of aggression since World War II under the reign of Hitler. So I think it's quite profound when you look at what we're doing and how history has a tendency to repeat itself, and nations have a tendency to repeat themselves. And what I hope in this instance is that the dereliction in some cases does not allow this to unfold further, as we're watching other nations start to take postures and positions of not allowing warships and other things to start moving. Wars is never pretty. It is one of the most horrific things that any one person could ever participate in, and the impacts on a society are even further. So, keeping in mind the Ukrainian people and those families that have been displaced and the other neighboring nations are important. I think now it's time for resolve. It's time for a calm thought and process in how not only we proceed as a nation, but the world is looking at it. So while we may not have any influence here and at the local level in St. Mary's County, I'm sure some of the thoughts that Commissioner Colvin and I have expressed are probably on everybody's head, and they're thinking it, and they're wondering what is next. So, it's a difficult situation. Aside from that, I think that my mom, it's her birthday. So, that's the best news in the world. I take the time with my parents every day. I either call or speak to one of them, and I'm just blessed to have my parents with me here in St. Mary's County. Moved down from New York and had lunch with my mom yesterday, so it was great. And she very tolerant of the boards that I sit on. As we were sitting at lunch, and I had to get on a call, so there was a quorum, and she was amazing and just really listening to things, and she's always been there. So happy birthday, Mom, and love you.
Yeah. Hi, Bird, Mrs. O'Connor. So reflecting on Ukraine, I sort of dressed subliminally today to show my support for Ukraine and its citizens along the way. It's March 1st. Today is the meteorological first day of spring. That's a good thing. Second thing is, don't forget that tonight's Shrove Tuesday. So there's numerous places in St. Mary's County to go out to tonight, get pancakes, sausage, eggs, bacon, fill yourself full of sugar, knowing that tomorrow Lent begins. Again, I want to congratulate Major Dietrich on her 36-year career over there in the jail. As Commissioner Colvin said, a really, really nice ceremony yesterday. Got to have it in the gymnasium in the jail, so she felt right at home where she was. Also, this past weekend was Maul Dyer weekend in Leonardtown. Started Friday night with a really interesting lecture at the Rex. Went all day Saturday with a ceremony in the morning, and Maul Dyer was there running around. Then they had a variety of other events during the day. That night they had a ghost tour through Tudor Hall, the old jail, a couple other locations along the way. It's a lot of fun for those that came out. So with that, please remember, be careful, take care of yourselves, and have a nice dinner tonight. Thank you.
The last of the dinner through that. There you go. Thank you, Commissioners, for all that. I also had a surprising SMECO bill, too, but it seems that power usage in my house was higher this month than it was last year. So I just looked at the two bills, and it really wasn't much higher than last year, to tell you the truth, but it was much higher than the month before. So this is not written in there. I was told this is not influenced by the increase in rate that they're going to have starting next month. So I'm unfortunate, but it was a little bit colder, so that's probably why the bills were a little bit higher and things like that. So I expected a higher bill. It is Women's History Month this month, and our Women's Board is celebrating by the, I think it's the 24th. They're having a Women of the Year type of thing. It will be presented here, and then reception later over at the Old Garvey Center. For those that are participating, we need to recognize those that, especially with all the volunteerism that you do. Our women in our county do a lot of volunteerism. And unfortunately, this last couple of years has been sort of dim on the number of people who have been volunteering. And we've had these problems right now with the increase in our EMS service, so we've had to go to paid. And it's understandable. It's just that some people just are not going to get out there because they're fearing, especially our older citizens. We're a little reluctant sometimes to get out there with this COVID, but hopefully we're slowly getting over that. We're getting closer back to normal, and I'm all for it. I'm all for no more mask mandates. Let's get back to normal as close as possible. For those of you who are at risk, I'm sorry that if you don't want it for every reason you can't get a immunization done, then you need to be more conscious about yourself and take care of yourself. It's up to individuals to do what has to be done. And the same with masking of our children and everything else. I believe it should be the parents' and their doctors to approve or not approve the masking mandates. Shout out to Major Dietrich. She took over the job as being the warden out there at a critical time. We were renovating and adding on to the detention center, and plus the COVID stuff hit at the same time, it seems like, and it's just been one very difficult time for her, and she did a great job of managing all that, plus the people that she had to manage. She did a great job. I have a shout out for the 26th of March again. I think this Lexington Park where they have that, almost like you might say our little cherry blossom parade stand out there. So participate and enjoy the new park that we've established out there, and it's done very well. It's looking really good. Okay, 1:30 we have a budget work session pretty soon, and then remember the public hearing tonight at 6:30 to discuss it's actually to establish a resolution to support the mandated, you might say, Senate hearing, the Senate bill last year for the St. Mary's County Police Accountability Board and the St. Mary's County Administrative Charging Committee. At this time?
Mr. President, I have a motion to move into closed session for the purpose of litigation and personnel.
What's that for now?
Personnel and litigation.
Okay, that's right. Okay. We'll go right into that at the same time. There'll be some, okay, go right into it.
Need a second.
Need a second?
Second.
All those in favor?
Aye.
Aye. Recessed, and we start right into this. Thank you. Meeting closed.